Okay, I think we're going to go ahead and call the meeting to order. It's February 10th, just after 9 o'clock, and I'd like to welcome everybody. This is our first meeting of 2022, and I appreciate your attendance and patience as we promote everybody. And I'm going to start, as always, by asking Adam to give us the instructions for our Zoom webinar platform today.
Thank you, Madam Chair. Good morning, everyone, and welcome. I will give brief instructions for this meeting. We are using the Zoom webinar platform. We will support public participation during this meeting. If you are connecting by phone, please be sure to mute your microphones or phone by dialing *6 to mute and unmute. When you are called upon to speak, please eliminate background noise before unmuting your microphone. If we missed you, please send a written comment to publiccomment@bscc.ca.gov. The email is available on our website as well. Board members, if you wish to make a comment on any of the agenda items, please use the raise hand feature on your Zoom or physically raise your hand so that we can see you. Members of the public, we will give the members of the public the opportunity to comment after the presentation of each agenda item and prior to the board voting on an agenda item. Agenda item 6 is the opportunity for any member of the public to make a comment on any agenda items or other comments in general. You will have 2 minutes for your comment. Participants who wish to make a public comment, please email publiccomment@bscc.ca.gov with your name and the agenda item you'd like to comment on. You can also use the raise hand feature on your Zoom application. If you are calling by phone, please dial *9 to raise your hand. I will call out the phone number you dialed in with. Unmute your phone by dialing *6. We will lower your hand once your name is received. You do not have to raise your hand again. We will record your name. Madam Chair, that concludes my instructions.
Thank you, Adam. How about we call the roll?
Chair Penner.
Present.
Ms. Allison.
Present.
Mr. Vera-Rosa is absent today. Mr. Groudon.
Here.
Mr. Haynes.
Present.
Ms. Vernon.
Here.
Ms. Guard.
Here.
Mr. Mills.
I'm here.
Mr. Budnick.
Here.
Mr. Steinhardt.
Here.
Ms. Kumpion.
Here.
And Ms. Chavez will be attending at 9:30. Madam Chair, we have a quorum.
Thank you, Adam. We're going to begin the agenda with item 2, which is a special order of business for the board today. And I'd like to make just a few comments before we start that item. And that if you had seen the agenda early in the week, I think you would have noted it was a matter regarding Los Angeles Central Juvenile Hall, and it was titled Determination of Suitability. We will not be proceeding as a determination of suitability. We will use that title at that time as a placeholder for what we propose to do today, and we will not be asking for any action by the board or vote by the board today. We will be briefed on a recent visit by our staff to Los Angeles County Probation Department Juvenile Hall, and it will become part and parcel of a corrective action plan that is ongoing. Before I turn it over to Deputy Director Allison Ganter, I'd like for us to take a minute and listen carefully to Counsel Aaron McGuire as he explains to us how to proceed in this agenda item.
Good morning, Madam Chair and members. Thank you. Yes, I wanted to walk through as what Chair Penner just talked about in terms of how this item was agenda and how we came to changing that agenda item. Our normal sort of standard inspection and corrective practice is set forth in the Welfare Institutions Code section 209D, which basically provides for an inspection. If we find items of non-compliance, We provide for a corrective action plan, which gets filed with us after 60 days. And then a county would have 90 days to remediate that incident. And then, failing all of that, we would then be on for a determination of suitability if those items are not corrected. That is what happened when we were back in September doing the determination of suitability for Los Angeles County for both of the juvenile halls. There's also a separate authority listed in Welfare and Institutions Code section 209, that's 209A4, which provides a broader authority, a general authority, so that if the juvenile court or the board inspects a facility and finds it completely unsuitable, finding that during that inspection that there can be an immediate notice, which would provide for a 60-day notice to everyone that the facility cannot be used for the confinement of minors. After the visit on Thursday that Deputy Director Ganter conducted at the Hope Center and at Central Juvenile Hall, on Thursday, we were seriously considering using that broader authority based on what our staff saw there. And I will turn it over to Deputy Director Ganter shortly to talk about that. That we were looking at very quickly expediting a proceeding, which we would be doing, have been doing a determination of suitability. The reason we put it on the agenda as such on Monday, at least preliminarily, was because of the Bagley-Keene Open Meeting Act, which requires us normally to have agenda items posted 10 days in advance. Because this item came to our attention after that 10-day posting, we're looking at using a different authority to handle urgent board items. And generally speaking, that still requires a 48-hour notice ahead of time before we could hear that item. So just to make sure that we could preserve the option of doing a suitability determination today, if needed, that's the reason that item went up on the agenda as noted. Late Monday evening, as Deputy Director Ganter and I were reviewing documents that we have received from Los Angeles County and taking a closer look at the policies, especially related to their health care, it looked like, from our perspective, that the probation department was following guidelines set forth by their healthcare services provider in response to the Omicron surge. And at that point, we determined it wouldn't be appropriate to proceed strictly with a suitability determination, but moving it back to our normal process of notice of corrective action requiring a 60-day plan and going forward from there. We're also concerned about setting a precedent of providing extremely short notice to the county to respond. We wanted to make sure they had an opportunity to respond as well, and having a one-day notice for them seemed very short. We did give them 30 days back when we did the proceeding in September. I don't want to minimize the situation as Director Ganter is about to describe it. This dealt with room confinement, which, as you know, we've been dealing with LA County for quite a while, and we still found them out of compliance for what we found there and are requiring corrective action. And then failing that corrective action, we will be back for suitability at the next board meeting. With that, I would ask, is there any questions at least on the process before I turn it over to Allison?
Just briefly, Aaron, my notes indicate that this was a plan that implemented in December. I think November is the accurate month, but my notes say December, so I just want some clarity there.
So when we found them out of compliance for the remaining items that came to our attention while Field Representative Lisa Southwell was doing her re-inspection, they were noticed for those items in October, actually, while she was doing those inspections, which made the corrective action plan for those new items due December 10th. And so that is the corrective action plan they're still working under, which we expect to be completed by March. And so what we have done, at least with this matter, is try to fold everything into that current timeline. So the items that were unaddressed or the new items that we found in October, these new items that we found as of Thursday we are trying to fold those into the same corrective action plan, at least in terms of timing, so that if those matters are still unresolved by March 10th, and then again, Lisa Southwell will be down there inspecting in mid to late March for our proceeding in April. And so we're trying to wrap all of those items up into that April meeting if they remain unresolved.
Thank you. Any questions of Aaron before we proceed to Allison's report out? Seeing none. Prior to Allison, as always, we will have public comment on this matter following all staffing reports. And as instructed by Adam, please get in the queue and reserve your remarks to 2 minutes. And I'm very hopeful we will not be repetitive, because I think we have a very long, aggressive agenda today. So Allison, you want to take it from here?
Yes, thanks, Chair Penner. Good morning, everybody. Thank you. Before I start, I would like to continue to acknowledge Lisa Southwell and the time and energy she's put into providing Los Angeles County probation with technical assistance and subject matter expertise for these past few months. I visited Central and Barry J. Nydorf juvenile halls last week so I could refamiliarize myself with the facilities that I've spent time talking with you all about. And while at the Central Juvenile Hall on Thursday, I visited the Hope Center. And a reminder is that the Hope Center is the place designated for room confinement, and that the facility had been found out of compliance with room confinement for not sufficiently documenting placements there. A colleague and I spoke to a youth behind a closed door and asked how long they had been in the Hope Center. And the answer was 11 days. And then during those days, they had not gotten time outside of their room for exercise, recreation, or programming. The young person mentioned that they had been in isolation even though they had tested negative, and this concerned us. We asked for more information on this youth's status, and what we eventually discovered through discussion and document review was that this youth was erroneously placed on medical isolation by Juvenile Court Health Services. Their interim medical director acknowledged this error in writing subsequent to our visit. The youth had been on a quarantine status after this error had been discovered, but they remained on the Hope Center and in their room until release in the afternoon on Thursday, the day of the visit. We're not disputing the need for isolation in accordance with public health guidelines, and certainly the exemption in Title 15, Section 1354, room confinement. What's troubling is that in addition to an error being made that placed the youth in isolation, outside of that error, it wasn't clear why this particular young person had spent so much time in isolation. The information about why they were there wasn't readily available. Probation shared with Bscc staff the documentation that there had been a surge of Omicron in the facility and that entire units were being isolated and quarantined. And we reviewed this along with various versions of the Juvenile Court Health Services guidelines related to the virus, and one that was updated subsequent to our visit. Upon the review of available documentation, we determined that the facility is out of compliance with Section 1354, room confinement, and Section 1371, programming, recreation, and exercise. It appears as though the youth had been erroneously and unnecessarily placed on medical isolation in their room in the Hope Center without access to programming, exercise, and recreation outside of their room. As board members are aware, on Tuesday evening, we provided notice to LA County about these new issues of non-compliance. And as Aaron mentioned, we're folding that into the current corrective action process that is set to be re-inspected for in early March, and then come before the board in April for discussion. I'm happy to take any questions that you may have.
Any questions from the board on this matter? Okay,
I have a quick question, Madam Chair. And I'm sorry, I should have raised my hand. I see Chief Mills had he had a question.
That's okay. Go ahead, Chief Mills. There you are.
Yeah, just a couple of real quick questions. One, do we know that it was more widespread than one individual Were we able to look at records to indicate that there were more than one individual, that there was more than one individual who was kept in isolation too long? And then also, if you know, with Omicron rapid expansion, I know that staff was obliterated in many of the correctional facilities. What was the effect on staff, and was the oversight due to that, or was it just neglect from the, of the policies and so forth of the juvenile facilities?
So to the first question, we don't know if there were more young people in their room confinement longer than they should be. When we walked through, we noticed this one person in a closed room. There was another youth on the facility with a door open. And so I am not sure if there was additional times that youth were placed in their rooms for a long period of time. With respect to if it was staffing, to our understanding, it was an error made by the medical care provider, Juvenile Court Health Services. It wasn't a probation error that caused the youth to be erroneously placed on medical isolation. That's our understanding.
And I suppose we'll learn more about all of this in the next 30 days as we move forward. But I mean, excellent points by you, Chief Mills. Kirk, did you want to ask a question?
Thank you. Just a quick question. I don't know if this is for Allison or for Aaron, but in regard to just the due process on this, since we're going to incorporate this into the current issues of noncompliance, and we'll revisit this at our meeting in April, would this new instance necessitate a new 90-day time clock, or because we're folding it into the existing, will due process allow for, if there is any kind of corrective action to happen? Would we expect for LA County probation to meet those requirements by the April 7th meeting? I guess that's just a due process question.
Yeah, Chief, and we're going to work with the county to make sure those timelines work. The corrective action in terms of following the corrective action plan is up to 90 days. It's a reasonable time up to 90 days. And so our hope and our understanding, again, because this was a unique situation with the error that occurred, our hope is it doesn't require that length of time to correct and ensure that it doesn't happen again. But it's something that we will have to discuss to make sure that the timelines are fair and in accordance with the welfare and institutions code.
Thank you.
Any other questions by board members? Okay, Adam, checking in, and how many do you have in the queue, please?
At this time, I have 2. When would you like me to close the queue, Madam Chair?
I think we'll let the first individual comment, and then after that, I'd ask you to close the queue. Go ahead, Adam.
All right, the first one is Aditi.
Good morning, Aditi Sharakar, Children's Defense Fund, California. It is truly incredible how many times LA probation has failed the youth in their facilities, and they continue to be given chance after chance. In this instance, Central Juvenile Hall was in violation of room confinement regulations last year when the Bscc first found the hall unsuitable. And then they claimed to have fixed this with audits and reviews. So even if this violation was technically a new type of room confinement violation, it still should have been caught in the audits and the reviews. Instead, we have, once again, another instance where Bscc inspections reveal noncompliance despite months of corrective action planning, and then second, third, fourth chances. It's clear that whatever safeguards and audits detailed in former corrective action plans failed, and here we are again. And every time there's a further inspection, more violations seem to be uncovered. So how can we trust the determination that the halls are now suitable for youth, given that failures of the corrective action plan just keep coming up with new violations? I also want to remind the board that this isn't a small misunderstanding between probation and JCHS. A young person was held in solitary confinement for 11 days alone in a cell without any programming. So I am imploring this board to please dedicate more time and resources to ensuring compliance and take seriously the obligation to keep our youth safe. LA probation has shown time after time they cannot be trusted to meet even the most minimum of standards. And the board needs to take this seriously at this meeting and the next one. Thank you.
Next, we have Brian Goldstein.
Good morning, Brian Goldstein with the Center on Juvenile and Criminal Justice. We're very concerned by LA County's violation on room confinement. As was just noted, a young person was held in solitary confinement for 11 days. It's worth noting that the Bscc only learned of this issue because they spoke with a young person. And so there's the troubling question, who could the youth have turned to if the Bscc wasn't there? This agency has to prioritize speaking with youth about facility conditions and creating more opportunities outside of these inspections. The Bscc has to reevaluate how you ensure compliance on room confinement regulations amid COVID-19. Counties shouldn't be allowed to use COVID-19 and quarantine practices as a cover for what is clearly a violation of room confinement standards. We are seriously concerned about how the Bscc and LA County is not protecting young people. Thank you.
Madam Chair, the queue was closed, but another participant raised their hand. Would you like to take that comment?
Yes, and that will be the final comment. Thank you.
Okay, that would be Nia.
Hello, Bscc board. My name is Nia Moore-Weathers. I'm a community organizer located in Sacramento, California, and I work in youth justice spaces and have been organizing around SB 823 advocacy the past year. I'm new to the Bscc space, and so a lot of these issues that you were just speaking about are fresh for me. However, as a youth organizer, and like I said, somebody who works in the justice space, it's absolutely appalling to kind of hear about how law enforcement agencies located in LA are not doing due diligence to protect and serve the youth who they are hired in their roles to do so. And so as a concerned citizen, I guess one of the solutions and recommendations that I could make to this board in order to ensure that our youth are being protected and properly cared for inside of the facilities that they are located in. And I'm sure that this is something that you've heard from community members before, but I would really encourage you to have a more transparent and accountable process when it comes to doing outreach with youth inside of our facilities, right? Learning what their experiences are, but beyond that, connecting with small grassroots organizations who actually provide healing from trauma to youth that occurs inside of these facilities, like my previous colleagues have mentioned, are coming from the hands of law enforcement officers who are inside of these places. So, you know, I hope that you hear that. I hope that you take these recommendations, and I really hope that your work in this board continues to center around the safety of our Black and Brown marginalized youth versus our law enforcement agencies who are perpetrating the oppression. Thank you.
Thank you.
That concludes public comment, Madam Chair.
Thank you, Adam. And I'm going to reach out to the board following public comment, but I want to take just a minute and thank Allison and Lisa Southwell for their diligence on this matter. And it is because of them that it comes to this board. I think I can speak for the board when I say that we're all very concerned when we hear allegations such as these, and it is our priority to work towards a corrective action plan. And we have expectations that LA will come into compliance, but if they do not, I think that the board is prepared to do what it takes to ensure suitability in LA. The allegations to each one of us, as we heard them roll out, are alarming. And as we indicate that, we also have to allow for due process for the conversation to go back and forth, so that when we do make a final determination in LA, it is done with all the information available to us. So I look to the board for any other comments. Yes, Mr. Steinhardt.
Mr. Steinhardt, I just feel frustrated. And I think the comment from CDF from Ms. Sherakar was right on. I mean, this is a pattern and practice over a long period of time of pushing against the rules, of violating the rules. And then we get these 11th hour responses that are so unpersuasive. And technically, they escape the unsuitability finding in LA. But this is just wrong. And I think that it was compelling to point out that but for Bscc, there would be no light shining on this and no remedy. It really points to the limits of our staff as well. I mean, our staff is bending over backwards to pursue due process, to discover these violations in the inspection process and so on. So we're just in a very hard a place here with a huge responsibility. A lot of people are disappointed, point the finger at us. But I must say, I am just not impressed with the way Los Angeles has responded here.
Thank you, Mr. Steinhardt. I appreciate your remarks very much. Chief Mills.
Just as a point of interest, maybe Aaron can comment on this. What are the remedies other than shutting down the facility? Should it go all the way to the end? Is there potential, for instance, of a court-ordered monitor that can be in the facility all the time, so we have some level of assurance that the rules are being followed? Maybe there's other things that I might be missing, but in government agencies, it's not uncommon for the court to appoint somebody to make sure that full time that they're following the guidelines that's set forth and paid by that agency. So maybe you can, what are the possibilities as we get down the road, or is that too premature to discuss those at this point?
Well, there already is a court monitor involved in this. Last year, the California Department of Justice sued Los Angeles County. They entered into a stipulated judgment and order. There is a court monitor. We've had conversations. Lisa Southwell's had multiple conversations with that court monitor. We've had discussions with DOJ about the current status of all of this. And we have never, the Bscc has not sued a county for compliance. And in fact, there's at least some AG opinions that suggest we don't have that authority to be a party that would sue for compliance in this instance. So what we are left with is the authority under the Welfare and Institutions Code, which is an all or nothing. It is they are suitable or not suitable. And if they are not suitable, then the juvenile hall shall not be used for the confinement of youth.
I just find it hard to believe that there's not a intermediate step that we can't create through the legislature or the governor's office or the AG's office, just to make sure that the public safety of Los Angeles, both the people who are incarcerated as well as the public, is protected. So there has to be a different solution that could come forward. The other, I'm just trying to brainstorm here, but putting these children in other places far from their homes doesn't seem like a good idea either. So, I would like for us, and I'd be willing to do the research also to, what are the other options available, and as we move forward.
Yet again, an important point, Chief Mills. I think we've, in the interim, had Lisa Southwell in LA a great deal of the time since we became aware of this report, and it was because we had staff out there that we're here today. But we do need to think hard about measures to protect in the interim. There's no denying that. Anyone? Okay, Anything further, Allison or Aaron?
Not at this time.
As we close this out, I mean, I could see on the faces of all of you that we know about the seriousness of these allegations, and I think we have grave concerns, and we will continue down this road and do what needs to be done, depending on the information LA provides us. Okay. Welcome, Supervisor Chavez. I see you there. You've been there for some time, actually. I just didn't want to interrupt proceedings. I'm glad to have you here, and we'll move on in the agenda. As we turn to the regular agenda, though, we have kind of a bittersweet moment in that our deputy director, as we like to say, over everything, she and Allison have a wingspan that goes forever. Yvonne Garner is retiring. I think her last day is Friday, tomorrow. Yeah. The board meeting is timely. She's been here for 17 years. She has overseen both our training and our administration division in her recent standing with us. And this is a tough goodbye because we're gonna probably have to hire 16 or 17 people just to cover what she's been doing for us. And her bank of knowledge will be greatly missed. As repeatedly, Katie and I have said that to her, and she continues to say, well, I'm going to come back one day a week. And we look at her like, yeah, we think you'll do that for about 3 weeks. No, we're convinced you'll do what you say you're going to do. But it is a tough goodbye. And before the board speaks, I'd like to invite Yvonne to say a few words.
Oh, thank you, Chair Penner. And it is a tough goodbye and bittersweet, all those things. It's been, I mean, truly been an honor to work for the Bscc and be a part of all of the important work it does. You know, during my 17 years at this board, which is really hard to believe it's been 17 years, but during that time, I have learned so much and had the pleasure of working with incredibly smart and talented people. And I'm really going to miss all of it. And I just want to thank you all for the opportunities and the experiences this journey has provided me. It's been an amazing ride, and I really will miss it. And I really will be back one day a week because I'm not ready to say goodbye entirely, but definitely taking a step back. And so many great people, you know, in this agency that you won't even miss me, Linda.
Oh my word. I think I heard her say she'd do it 3 days a week just now. Didn't anybody? Oh.
Thank you all so much.
I don't think we're gonna get out of this without hearing from our executive director, who is taking this as hard as I am.
Yes, any comments any board member would like to make to Yvonne? Yes, thank you, Sheriff Groudon, and I'll go after you.
Well, let the record reflect, I tried to let Katie go before the board. She deferred. Okay.
Yeah, I just want to thank Yvonne for the great work she's done all these years. She's made, accomplished a lot with the STC, with the training division. A couple things of note. The supplemental core courses that we got wrapped up a couple of years ago that really helped. Local agencies, probation, sheriff's office, and so on. So, Yvonne, I didn't know you were retiring. I'm disappointed to hear that because you've done a great job. But we wish you all the best in retirement.
Thank you so much, Sheriff. It's been great working with you too.
Anyone else on the board?
Madam Chair, I just want to just say congratulations to Yvonne on your retirement. Even before I was on the board, working with you here in the department, working through SDC compliance, and just you've been just a consummate professional. So I appreciate all of your professionalism and good luck in your next adventure.
Thank you so much, Chief.
Okay. Katie Howard.
Thank you, Madam Chair. Good morning, board members. I'll say a few things to Yvonne and then segue into other items to report. It is really, really hard to say goodbye to Yvonne. I know she will always be my friend, and that's probably the most important thing. But I want to take the opportunity to acknowledge and thank her so very, very deeply here before the board for the leadership that she has shown, for the depth of her commitment to excellence and figuring things out and being an innovator, and all of that. We will miss you, Yvonne, so very, very much. And we are going to be okay. I don't want you to worry about that because we have such a terrific team at the BSCC. But I mean, on a moment of personal privilege, these jobs are hard. And to be able to have colleagues to work through big challenges and look at things from multiple angles and what else might we do and how can we improve, those are the kinds of conversations that Yvonne brings, and that's the kind of leader that she is. And her contributions to this organization are huge. I can kind of picture her colleagues both in STC and in the administration division just nodding their heads and saying, yeah, Yvonne is truly amazing. And it's been to all of our shared benefit that she's been part of this organization. I remember when I came on as the executive director in 2013, Yvonne was a shining star, from the very first moment. And so Yvonne, from me personally and professionally, thank you for all that you have done and all that you have taught me in my role. And I'll miss you.
Oh, thank you, Katie. Yes, and vice versa. I've learned so much from you too, and from everyone that I've really had the opportunity to work with over the years. Like I said, it's been amazing.
All right.
All
Well,
right.
Madam Chair.
Let me, yeah, there's no way to segue. And, you stay till 5 o'clock today and don't you do a thing other than that. You only have one more day left. All right. Moving on now to information items. The board members received public comment letter from Sue Burrell about conditions in juvenile facilities related to COVID in the last couple of days. This has also been posted on our website, and Katie will address those during her COVID report in a portion of the meeting that's upcoming. We're now on to information items for the board, and I quickly will report out in my moment that we had an opportunity on Monday of this week to present to the California Police Chiefs Conference, and it was an informative convening, and I dare to say that with the number of grants that are funds coming the way of the Bscc and the governor's proposed budget, I think there was a lot of positive response to that in my report out. As I say that, I think at the same time the amount of work associated is enormous, and but I committed to them. I commit to the board that this will get out in a timely fashion as soon as the legislature and the governor's office hands it over to us to go to work. We had a great lunch this week. I don't know did we announce to the board that the Office of Youth and Community Restoration hired their executive director? Maybe we haven't seen the board since then.
I think that's right.
Okay, and they have their house counsel. So Kathleen Lucero is their new executive director. She is formerly a judge in Santa Clara County, and at some point we'll do a meet and greet with the board and Catherine, and also Counsel Alyssa Hartz, who is working hand in hand with the executive director to roll out this new program. And heavy lift, and I hope that they will see the Bscc as their partners in their endeavors, and we're really excited going forward. If the staff appointed is any indication of the success they're going to have, I think they're going to fly high and do well. So it was a great lunch and a great meet. Anything further on that, Aaron or Katie, on our meeting with them? Okay.
We'll talk about a few other things. I would just add my appreciation for the collaborative working relationship that we have started with the Office of Youth and Community Restoration, Director Lucero and Counsel Hartz. There are many areas of responsibility in which we will be able to work together and look forward to doing so.
All right. That just segues right into you, Katie. We're now looking forward to the Executive Director's report.
Okay, great. Excuse me while I send one very quick text. There There we go. Okay, thank you, Madam Chair and board members. I'm going to turn to the COVID-19 updates as Chair Penner referenced, and I'll just take a moment to, I sure hope that I will properly open the slide presentation, share screen. I think it's this one. Do you see that in slideshow mode? Yes? Okay, terrific. So on COVID-19, obviously, in the last 2 months, there have been huge surges in positive cases across the entire globe, and our county detention facilities here in California reflect that. Our first slide always simply reports the overall average daily population trends in the county jails. And as you can see from the time, roughly the time that the COVID-19 pandemic began, the statewide population trends in county jails have dropped quite a bit initially. And over the past several months, they have been moving between 60 and 62,000 approximately. The range since December has been 59,000 to 61,000. I'm a little unsure if this is showing properly on the screen, but I'm gonna see what happens.
It's not quite in slideshow
Yeah,
mode.
it's not in, yeah.
Okie dokie. Let me try this again. I know that I messed this up last time, but I want to do this so you can see the slides along with me. So I'm going to stop share and then try again. Share screen, PowerPoint presentation. I think it's this one. Share.
Still not quite slide mode. We can see all the information though.
Okay. All right. So no more teamsing for the next little while. Okay. So turning to the numbers again, as you would expect, the COVID case trends in the county jails began really picking up at the end of December and through January. So the number of people tested went up significantly. You see a very large spike in the number of confirmed positive cases in the middle of January, and then the beginning of, thank goodness, a very significant drop off in the number of positive cases. And these issues, as we're talking about, and as I'll tie in a little bit with what Allison reported earlier, there are real consequences in the county facilities and challenges with managing the COVID-19 cases. Here are the case trends, the positivity rate of detained people. Again, these are in the county jail facilities. The positivity rate appears to have peaked in the middle of January and has begun to drop again. We show the number of hospitalizations of people statewide. And so during the data reported in the middle of January, it was as high as 6 people hospitalized. And then I read the January 29th data to be 2. So at least those numbers are starting to turn around. The overall statewide average daily population of juveniles in the county facilities dropped very precipitously, as we all know, and has continued to stay close to 2,000 statewide. There were increases in positive cases in the juvenile facilities, as you see here, and similar patterns with a big spike and then a drop. I do want to address one of the issues, and I'm going to step through a few of the issues that were raised in the letter from the Pacific Juvenile Defender Center. There is understandable interest in the specific number of cases that are positive, and we have a public health protocol for purposes of medical confidentiality that we do not report a specific number if the number of cases at a particular facility is under 10. We worked really hard to understand the laws and the limits on how these COVID data can be properly reported. And the State Department of Public Health was very clear in saying, if the number is smaller than 10, you need to say between 1 and 10, you need to say less than 11. The letter from the Pacific Juvenile Defenders has said, gosh, it would be much more helpful to actually know, is that number 2, is it 5? What is the specific number? But we do not have the flexibility to report that way. I'm going to finish this out by showing you again, because we show these bands, if the number is 1 in the less than 11 grouping, you'd see a positivity rate of this lower line, the dark red, and then I hope you can see the higher line is in a gold color. But we believe that the numbers are much closer to 1, which would be at the bottom of the screen. So I'm going to stop my share right now and then address the materials that are on our website in connection with this information item from Sue Burrell. There was a letter dated January 25th that listed numerous concerns about conditions in juvenile detention facilities related to COVID. And then just yesterday, we received an article that appeared in the California Journal of Politics and Policy titled COVID-19 and California's Detained Youth, Vulnerable and Overlooked. That article is posted on our website, and it includes a number of recommendations, some of which are directed at the Bscc. We just received that report yesterday, so I'm not going to respond in detail on those recommendations, but I want the board to know that Deputy Director Allison Ganter and I will be meeting with PJDC representatives next week to talk about some of the information. And in particular, some of the information that we regularly post on our website about suspension of regulations in the facilities. We want to be, we do try very, very hard, as I think today's meeting reflects, to be transparent, to provide information on our website, to do the very best that we can to let all who are interested know about what the status is in detention facilities. But if there are ways that we can further improve the information we're posting about emergency regulations, Allison and I and our team are happy to do that and take suggestions. Sometimes, we had an issue about 3 or 4 weeks ago where one of the links no longer quite made sense, and we moved very swiftly to correct that. So I'm here to say, let us know what your questions are, and where we have information that we can share and share better, we will absolutely do so. Chair Penner reviews the requests for emergency suspensions every time they come in. We extend the suspensions of things like, and it really, again, ties back to what Allison has been reporting about this morning, about what we're seeing in the juvenile halls, and when regulations are suspended and there's isolation and quarantine and people aren't getting programming, treatment, and all of those things. We want to be sure that we are tracking the changes to the regulations that have been requested from the counties. And in some instances, I think there may be a view out there that the board just greenlights every single request that comes in. That is not the case. Chair Penner reviews those. Allison and her team provide the information and the rationale that we receive from counties. And in some instances, we do not approve requests for suspensions. I just want everybody to know that. In the PJDC letter, we noted with great interest that the biggest overall concern that was cited is that youth, the juvenile defenders are hearing in their discussion statewide that young people are being placed in solitary confinement during isolation/quarantine. Obviously, we brought that issue to this board on an emergency basis when we saw it in Los Angeles. We take this very, very seriously. So to underscore, we are addressing specific issues with non-compliance with regulation as they come up. And we always want to provide information that we have as clearly as possible. One of the specific recommendations in the letter was to reinvigorate the process for suspension. I think I've laid out for you how that is actually working. And if there's more information, from the historical suspensions and so on, again, Allison and I will talk and provide more information if we can. Our field representatives who inspect in these facilities are in regular, I would say daily contact with facilities as these issues come up. And then, of course, as this Omicron surge begins or continues to wane, we absolutely anticipate there will be a drop in these suspended regulations, and we will be working with the counties to ensure that. I just feel like I would also want to mention that there is an interest that I see and I understand about, and it's come up in this conversation today, gosh, isn't there more that the Bscc can do? I think we are operating within our statutory authority to the greatest extent of our ability. Chief Mills asked some great questions. Should there be some further statutory changes? absolutely happy to talk about those things. But in terms of what we do and how we are in contact with the counties and how we're sharing information about our role in oversight of the regulations and suspensions of those, that's what we are doing. We have provided guidance out to the counties and will continue to do that. And I just feel like sometimes there's a request like, gosh, Bscc, please do more. And we're open to those conversations as well. Of course, I guess in closing, I would say so many of the regulations and public health guidelines are changing and shifting and, in flux constantly, that these things are hard to keep up with as well. I'll stop there on the COVID updates. I'd like to step through a few other information items, and then of course we'll have time for questions from the board and public comments as well. But if I could, I'd like to turn to our Bscc budget update, which Chair Penner mentioned in the opening. When the governor's budget was released on January 10th, several new grant proposals have come the way of the Bscc. The governor has proposed significant funding to address organized retail theft prevention. So that proposal, I'll start there, is for $85 million in general fund for each of the next 3 years. Details on that proposal are still being worked through, but the idea is that this is going to be funding for local law enforcement to combat organized retail crime, and it'll go to police departments, county sheriffs, and probation departments. Also connected to that is a proposed grant of $10 million one time for district attorneys to create dedicated retail theft prosecution teams. So this is the vertical prosecution grant proposal. There's also connected to local law enforcement a proposed gun buyback program of $25 million one time. So those are all connected to organized retail theft and crime reduction proposals from the governor. Another very significant proposal connected to the Bscc is a county operated juvenile facilities grant in the amount of $100 million one time. This proposal has already been heard in the Senate budget subcommittee. That was last week. Lots of questions from the legislature about how to prioritize the funding and how it will go out. There's a real interest on the part of the administration for this funding to go out quickly. I will just say today that we're in very, very active conversations with legislative budget staff and the Department of Finance and others about how this funding can most efficiently roll out with appropriate accountability as well. Several other budget updates or funding updates in terms of dollar amounts that I'll just mention super briefly. For our Proposition 47 grant, there's an increase of about $31 million in this year's budget. And there's also, the budget includes about $70 million for the Prop 64 grant program as well. I will stop there. We provided all this information out in an email to the board, and I'm happy to take your questions later. I want to turn at this point to an audit report that was released last week by the California State Auditor. And the audit focuses on the San Diego County Sheriff Department. As I'm sure you saw, and we did provide information to board members. It's also posted on our website, I believe. But I'm happy to share with you today a little bit about the audit that focused on San Diego County deaths in custody, which the audit report shows that in San Diego County, those deaths in custody rates are higher than average for other counties. And of course, this is a topic of grave concern that we pay attention to. The recommendations that point directly to the Bscc have to do with how mental health screenings are done, how safety checks are conducted, and the training standards. we provided a letter of response to the audit, and that's available on the auditor's website. That indicated in that letter that we believe there should be some attention given to whether further modifications to the Bscc regulations would be warranted in this regard. We do take issue with the recommendation on training standards, having not seen in the report a specific linkage between training deficiencies and high incidences of deaths in custody. So, we want to have, a good discussion about this and make changes where appropriate. And I believe that that's something that we can do in a structured setting as we look at the related issues that were the topic of recommendations for the Bscc in this audit. I would also like to mention that we continue to work on forming executive steering committees for major grants that the Bscc administers. So we have the Burn JAG ESC that we are looking for members, as well as Proposition 64. So please, if people are here attending and might be interested in serving on an executive steering committee, we can't have the transparency, the participation, the different perspectives that seem to be so important, that are so important, without also having help and participation on executive steering committees. So please, if you or anyone you might know is interested in participating on those committees, we have a button on the website for providing a statement of interest to us to serve in those roles. So I will stop there, Madam Chair, and I'm happy to take any questions or comments that the board may have.
Okay, and we'll go to those public comments after the completion of this portion, but anybody from the board want to talk to Director Howard about anything she reported out on? David Steinhardt.
Yeah, on the COVID letter from the defenders, I thought it was a good letter, and I thought it was generally constructive in tone. And Katie, you addressed so many of the issues that they raised. And I believe Sue Burrell, who wrote the letter, we're going to have a little public comment window here, and she'll have her 2 minutes to respond to what you said. This just really raises the whole issue of capacity in my mind, and it overlaps with the LA discussion. How can we ensure that unvaxxed staff aren't exposing kids to COVID and forcing quarantines when they shouldn't be? Or, is it right that parents are not told that their kid is tested positive? Or the other allegations? And what I would like to see is a kind of a colloquy follow-up with the defenders who gave a kind of a reasonable list of what seems like things that are within Bscc's authority, as opposed to complaints we get about things that are well outside of what Bscc can do. So I'm just looking for a constructive dialogue as a kind of a follow-up. And again, sort of troubled by the capacity issue. I mean, do we need to double our inspection staff to deal with all this? If so, that has to go to the legislature, and they have to fund that because we're going to be frustrated in the meantime in being unable to respond on a global level here. That's all.
Thank you, David. We did receive a BCP last year to be able to implement our enhanced inspection process, and we are very, very pleased to be able to add to our FSO division, hiring both more field representatives who do the inspections, as well as a really terrific manager and analyst staff to track all the data, report back to the board. But I feel, as you do, David, that the legitimate request for, assistance, oversight, and all of that that's out there, I never want to, do the whole, we're trying so hard, but there is a part of me like, really, we are working through multiple issues as thoroughly as we can, and we have to square our available resources in terms of staffing and statutory authority with the work product that we provide. So, and we're going to talk about the strategic plan later today, and I also see very helpful and connected tie-ins to how we can do an even better job about providing information about what we do. That part should be easy, in terms of questions that come in and answers that we can provide. Here's what we have. Here's how we see our both our capacity and our statutory authority limited. Those get to be the more thorny and difficult parts of the conversation, but we need to have them, and we'll continue to do so. Thanks, David.
Anyone else from the board? Shall we, let's go on to any legal update that there might be and legislative update, and then open it for public comment.
I have no specific legal update, Madam Chair. I would just note for the board, as usual, that we have several grants that are on for the agenda in terms of releasing RFPs. And so to the extent that our board members could make sure they take a look at those, who the eligible applicants would be, and whether or not the entity that you work for might be interested in applying, to make sure that we recuse themselves. I'm going to go ahead and flag a couple that I know where recusals should probably take place. First, we actually have a matter on the consent calendar, which is extending a JAG grant for 6 months for Lassen County. Sheriff Groudon, I'd look to you to recuse on that vote when we get to the consent calendar. We have the adult reentry grant for services for people who are leaving state prison. I would look to board members Butnick and Kumpion to recuse on that matter. And Prop 47, certainly Supervisor Chavez would look to you to recuse on that matter. Santa Clara currently has a Prop 47 grant. And then probably all of our government employees should take a look at Prop 47 on that, especially our county board members for potential recusal on that matter. With that, Madam Chair, I think we can proceed back to the regular agenda.
Back to the agenda. Anything from the board prior to going to public comment? All right, Adam, do we have anybody in the queue on?
Madam Chair, we currently have 2 members of the public in the queue.
Okay, and then we'll close the queue. Please call.
Yes. First is Nancy Juarez.
Are you out there, Nancy? How about we'll go on to number 2, and maybe Nancy will reach out.
Next is Avalon.
Good morning, everybody. Can you hear me?
Yes.
Good morning, members of the board. This is Avalon Edwards with Starting Over Inc., based in Riverside County. I'm here today to request that the board take a more proactive approach in preventing the further spread of COVID in county jails. Advocates have been asking this board for months to provide comprehensive vaccine education in facilities and to track vaccination rates among jail staff and incarcerated people. The longer the board neglects to engage in meaningful vaccine education and mandated vaccination tracking, the longer our communities stay in the dark about COVID outbreaks and the health of their incarcerated loved ones. We cannot trust sheriff's departments to engage in truthful and comprehensive vaccine education and distribution when vaccines have been turned into a political issue rather than a public health one. Sheriff Chad Bianco in Riverside County has publicly spoken about his opposition to the COVID vaccine and is not requiring jail staff to be vaccinated, allowing staff to bring COVID cases into the jail system on a daily basis without consequence. Impacted community members and advocates cannot rely on sheriff's departments to protect our incarcerated loved ones from COVID, and continue to request that the Bscc step up to promote widespread vaccine education and data collection. Thank you.
Thank you.
Next, we have Brian Goldstein.
Good morning, Brian Goldstein with the Center on Juvenile and Criminal Justice. COVID-19 remains a public health crisis in our jails and juvenile facilities, and we want to echo the recommendations raised by the Pacific Juvenile Defender Center, and we want to extend those recommendations to California's jails. We think that Bscc must promote stronger implementation of COVID-19 safety measures and investigate conditions. We just heard about a young person held in solitary confinement for 11 days amid COVID. These COVID issues are happening elsewhere. Per a late January media report, we've learned that LA County Sheriff's deputies are ignoring COVID-19 regulations. They're spreading misinformation about vaccines inside the Twin Towers Correctional Facility. One social worker is quoted as saying, "It is chaos in there," and no one will admit that truth. We are also once again asking Bscc to collect data on vaccination rates of incarcerated people and staff. Starting in April 2020, we repeatedly asked Bscc to collect COVID-19 testing data. and this agency repeatedly said that you couldn't do this. Finally, in July 2020, you began collecting testing data, and we're now hearing Bscc refuse to collect vaccine data for the same reasons that were given earlier. So we hope that this agency will take swift action to address these issues. Thank you.
Lastly, we have Sue Burrell. Did you still want to speak?
Yeah, just for a minute. I mean, I think that, by the way, good morning, Madam Chair and members of the board. And thank you for this discussion. When Katie said, if things go wrong, let us know. The Pacific Juvenile Defender Center has been letting you know since March of 2020, when COVID first hit the scene. We had a series of meetings with you back then. We asked you, among other things, to provide a complaint process for youth and families and others to report problems with COVID. And you told us that that was beyond your statutory purview. And in many other ways, we had the impression that you did not believe you had the statutory or regulatory power to do many of the things we wanted you to do. And so based on that, last summer, Shannon Wilbur and I wrote an article making policy recommendations for change through legislation or through regulations in Title 15 for how to get a grip on having an appropriate response to the emergency situation we find ourselves in with COVID. And so we hope that this is something that people will use as we go forward in the next legislative session and in the Title 15 regulations, because we really don't have the tools we need to do it. We said in the article that if we didn't get a grip on this, the same thing would happen again in the next epidemic. And of course, here we are now in the middle of Omicron and hearing this parade of horribles that I detailed in our January 25th letter to you. So I continue to believe, and my organization continues to believe, that the state does have an oversight role in correcting, in investigating and correcting these deficiencies that we're seeing, such as was reported in the Los Angeles case this morning. And by the way, Los Angeles is one of the groups who was in our forum on January 20th. So I look forward to our continued discussions, but we are not anywhere near where we need to be in terms of having an appropriate structure for responding to these kinds of emergency situations. And I very much appreciate Chief Mills' remarks on that point. So if I can answer any questions, I detailed in the January 25th letter 18 conditions that are reported by juvenile public defenders that are bad things that are happening to young people in our county facilities right now. So I hope that the suggestions we've made, I think the ones in the January 25th letter are all things that you could do right now. There were 5 of them, except I guess maybe you can't do the one about not reporting less than 11 to report accurate data. But all of the other ones are things that you could do, and I hope that you will. Thank you very much.
Thank you.
That's it for public comment, Madam Chair.
Thank you, Adam. Any members of the board wish to comment further? Okay, moving on.
Madam Chair, this is Katie.
Yeah.
I just wanted to alert board members and everyone who's participating that there is a legislative report under the information tab. Nothing specific to highlight there other than to just say the legislative report of bills we're tracking is available in your materials. Thanks.
Thank you. And thank you to Secretary Allison for inquiring of me when we pass that one, because that would be important to note. Moving on now, we're at the consent agenda items. That is item A through D. If you would like to pull any of those items for discussion, please let us know. Any members of the public wish to pull any items from the consent agenda?
Madam Chair, Dean Grouden here. So I need to recuse myself from item D.
Okay,
So can we consider that separate from the other items?
yes. Yes, thank you for that. Noted. Okay, seeing no public comment, I will ask for a motion.
All right, Madam Chair,
Yes,
I'm sorry, I would ask also to recuse from item D as well.
okay. A motion on the consent items A through C.
I'll make the motion, Dean Groud.
Thank you. A second?
Chavez.
Thank you. All, I'm sorry, we cannot do all in favor. Adam, take the vote.
All right, Chair Petter,
Aye.
Miss Allison,
I think she's saying aye if I read it
Aye.
correctly.
Sorry, I was trying to unmute.
Mr. Gravin,
Aye.
Mr. Haynes,
Aye.
Ms. Vernon,
Aye.
Ms. Guard,
Aye.
Mr. Mills,
Aye.
Mr. Budnick,
Aye.
Mr. Steinhardt,
Aye.
Ms. Kumpion,
Aye.
Ms. Chavez.
Yes.
Madam Chair, the motion carries for items A through C, and Mr. Gravin and Mr. Haynes recuse for item D.
Moving now to item D on the consent agenda. Do I have a motion for approval of item D?
So moved.
Second?
Kathy Olson.
We have a second. Adam?
Chair Penner,
Aye.
Miss Allison,
Aye.
Mr. Gravin recused, Mr. Haynes recused, Ms. Vernon,
Aye.
Ms. Guard,
Aye.
Mr. Mills,
Aye.
Mr. Budnick,
Aye.
Mr. Steinhardt,
Aye.
Ms. Kumpion,
Aye.
Ms. Chavez.
Yes.
Madam Chair, the motion carries.
Okay, thank you all. Moving now to the discussion items on our agenda today. I'm going to take chair liberty and ask to move item L to the top of the discussion items. And looking here now for Helene Zentner to present on this item.
Yes, good morning, Madam Chair and board members. My name is Helene Zentner, Field Representative with the Corrections Planning and Grants Program Division, and I'm presenting Agenda Item L. And I'd like to thank you, Chair Penner, for allowing this item to be taken out of order, as the outcome of this item impacts requests for proposals being presented later on in the agenda. This agenda item requests the board's approval to increase the maximum indirect cost rate percentage allowed for state grant-funded programs that have a federally approved indirect cost rate. This rate update is not to exceed 20%. As you know, indirect costs are shared costs of an organization that cannot be directly assigned or identified to a particular activity, but are incurred and necessary for the operation of that organization. These are things like rent, office supplies, and administrative expenses. The division conducted a survey regarding indirect costs of its grant recipients to better address the fiscal needs of our state projects, and the results of that survey are provided within this report. Based on those results, the division is requesting that the board approve a maximum allowable indirect cost rate not to exceed 20% for state awards for those organizations that have a federally approved rate. All organizations using their federally approved rate will be required to submit that documentation for reimbursement. For those organizations that do not have a federally approved indirect cost rate, the division will continue to use the process set forth in existing Bscc grant agreements for indirect costs. If approved, this change is to apply prospectively to programs that currently do not have fully executed grant agreements. This concludes my presentation, and are there any questions?
Any question? I know this is really technical in nature. Anybody have any questions?
I do have a question. Does that include the salaries for, let's say, their CEO or staffing?
Depending on for the indirect cost rate, you mean?
Yes.
Yes. So anything that they've determined as their methodology for indirect cost rate, then yes.
Question?
Yes.
So for those without a federal rate, it was unclear to me, would they stay capped at 10%, or
Correct.
would there be, so it'd be 10 or 20, but nothing in between?
Well, up to 20% for those federally approved rates. So if they have a 12.5, then that would be the maximum that they can request for reimbursement. Anyone without a federally approved rate would be at the same rate of 10% of their grant award. And that's following the de minimis federal guidance.
Will you be monitoring this to see, for example, if they say that they're in LA and their rent is X? I mean, it's clear justification versus it's not rent, but they're trying to give their, let's say, CEO a 10% raise. I'm just trying to, and maybe I'm old. I remember some old history with other nonprofits. So that's why I'm asking the question.
Yes, we do. On our invoices, we have narrative that they must justify the expenses, and that would include in the indirect costs. For their 10%, we are going to ask what the methodology or the components of their 10% that they're going to be using for, so we can double check to make sure that those items in the narrative are not being claimed also, along with that 10%. We have desk reviews that we do with supporting documentation, and then on our monitorings, we go out and actually look at all the supporting documentation for that line item, outside of all the other line items too.
Okay. Anything else from the board? Anything from the public, Adam?
I do not have public comment for this item.
Okay. Moving back to the board, I'm looking for a motion and a second on this item.
Dean Groudon, I'll make a motion we approve staff's recommendation.
Thank you. Second?
I'll second.
Thank you. A very timely second by two people. Take your pick, Adam. Now, Adam, please take the roll.
Chair Penner,
Aye.
Ms. Allison,
Aye.
Mr. Groudon,
Aye.
Mr. Haynes,
Aye.
Ms. Vernon,
Aye.
Ms. Guard,
Aye.
Mr. Mills,
Aye.
Mr. Budnick,
Aye.
Mr. Steinhardt,
Aye.
Ms. Kumpion,
Aye.
Ms. Chavez.
Yes.
Madam Chair, the motion carries for agenda item L.
Thank you. Motion carries. We're moving on now to item E, that is the minimum standards for local juvenile detention facilities, Title 15 and 24. And we want to launch the regulation review, and Allison Ganter will be presenting on this item. Allison?
Good morning again, Chair Penner, board members, colleagues, and members of the public. I'm Allison Ganter, Deputy Director for the Facility Standards and Operations Division. And we are asking your approval to launch the 2022 Juvenile Regulation Revisions process. So in this report, I'm going to explain how we'll launch the process with a extended public comment period in which we hope to hear from system involved people, family members, local facility managers, community-based organizations, and subject matter experts from a variety of areas, including medical and mental health, legal advocacy, etc. We're also going to request for any interested person to submit a statement of interest to participate as an ESC member. I know Executive Director Howard talked about those opportunities earlier in the meeting. And we're also going to share how interested people can begin to get involved with the process and stay updated on the timeline. So as you know, we are wrapping up the final revisions to the adult regulations. It was an interesting and I must say challenging process with all of the pandemic effects, but we really have come up with some enhanced and strong regulation revisions that will be effective hopefully within a short period of time here. And a difficult part of that process was postponing, rescheduling, and then holding meetings over Zoom. However, there was a positive in that challenge as well. With the ability to reach people virtually, we were able to receive extensive community input and participation. So we hope to build on that and improve the regulation revision process based on what we learned doing the adult process during a pandemic. We're still kind of in that zone. So again, hopefully more opportunities. So it's vital that we have meaningful and broad input and participation in this regulation revision processes. We're grateful that over the years, we've increased the level of public input from people who have been directly impacted by incarceration, advocates from community organizations, and people who work in detention facilities and allied fields such as mental health and program providers. Now, while we had planned to open the public comment period tomorrow, as indicated in the report, we're going to pause just for a short time here to continue a conversation that we began with some of our community advocates about the public comment period. It will still be 90 days. It will start soon. However, we really want to be considerate of how we are requesting input. So please stay tuned on that. The report says February 11th, which is tomorrow, through May 11th. Those dates will change. Rest assured, we are not impacting any timelines or reducing public comment due to this pause. It's intended to enhance the process, actually. So with your approval, we'll launch our juvenile regulation process shortly with an initial 90-day community input period. And that will include the opportunity for all interested people, again, community members and people who work in and manage juvenile detention facilities, to provide any information on changes they'd like to see in regulations via a survey on our website. We will also hold at least one community listening session so that people may speak directly about their suggestions for revision during that time period. And as we receive comments, our team will begin compiling them in preparation for the Executive Steering Committee discussion. So on the Executive Steering Committee that we will be seating for this process. As we progress through this initial public comment period, we're going to request that people who are interested in participating in the Executive Steering Committee inform us through the ESC link on our website. We intend to seat an ESC that draws from a broad range of expertise and experience and includes people who haven't experienced incarcerations themselves or through a family member. Again, people who work in and manage juvenile detention facilities, advocates who represent community needs and interests, subject matter experts in trauma, youth behavioral health, pediatric and adolescent development and medicine, and any other area where the best practices in youth, best practices for youth housed in detention facilities can be incorporated into these standards. We'll provide updates on our website. We'll also share proposed Executive Steering Committee chairs and co-chairs and composition with the board in April. So a note on the collaboration with the newly formed Office of Youth and Community Restoration. An interesting feature of this particular revision is that we are required to collaborate with the newly formed Office of Youth and Community Restoration to develop regulations for secure youth treatment facility, those facilities that will house youth who would have in the past gone to a DJJ facility. We're going to be sure to address this separate set of issues related to the SYTF and DJJ closures thoughtfully, and really look forward to working with OYCR and community members to develop regulations that consider beneficial outcomes for our youth and are also aligned with best practices. We've already spoken with OYCR Director Catherine Lucero, and she has agreed to participate as a member of the ESC. So a quick note about how people can participate in the process. First, familiarize yourself with the regulations. They are available on our website. Our website will be updated soon. You'll still see the link right now for the adult regulation revision. There will be a link up there for the juvenile regulation revision. Bookmarking that will give you access to all of the timelines and updates and upcoming activities. And soon you'll see a survey for people to submit comments on regulations. You can also send suggestions at any time to our regulations@bscc.ca.gov email address. Sometimes suggestions for multiple revisions are contained in other correspondence. Feel free to send them through that email address. And you're also welcome to kick it old school and send us a letter through the mail. I spend a lot of time in the office, so I'm happy to receive that mail. As I mentioned, bookmark our website, check back for updates. We'll notice when we're going to hold listening sessions. There will be a mechanism for registering interest on the ESC, on the juvenile regulation revision page, as well as our ESC page. Current regulations are available out there. Again, familiarize yourself with those documents, what they look like. And with that, I request the board to approve the FSO team to launch the juvenile regulation revision and begin to solicit input for executive steering committee members. And I'm also happy to take any questions.
Thank you, Allison. And thank you, Director Lucero, for agreeing to participate. This is a huge first step for our agencies, the collaboration. I think this is a really positive outcome from Allison's fishing around for membership already. If it goes this good all along, we're going to have the best ESC ever. So anything from board members on this process? I would urge board members to continue to communicate with staff on anyone they think would be interested in participating in this effort. We're struggling right now getting ESC members in many instances because it's this virtual time of life has not lended itself to people ready, willing, and able to come forward with us. So please, board members, keep us in mind when you think you have an individual that could give their expertise to this area. Any public comments on this?
Madam Chair, this is Katie. Supervisor Chavez has her hand up.
Oh, I apologize, Supervisor. It's not right that I just did that to you. I apologize.
Oh, no. Goodness, I couldn't even start my computer today, so no judgment here at all. So first of all, thank you so much to staff for the report. And I think when I read it, I heard more today than I saw in the staff report. So I just want to affirm what I think you may have already said, Allison, and then with two requests from my colleagues. I appreciate that this executive steering committee, you're going to be looking for individuals and community members and advocates with lived experience and who are that are going to be parts of the continuum of care, so that there's a lot more expertise from lots of different voices. Is that accurate?
Absolutely, yes.
Okay, so we're looking at community members and advocates as well. That's wonderful. Two, that the mechanism for the outreach to the community about the upcoming application process and deadline, how is that happening? Is that happening through this discussion or emails to everybody who normally phones in? How is that happening?
You mean particularly for interest of the executive steering committee? Yeah. So we have I hope that it's a familiar place for people who are interested in participating in Bscc processes. There's a spot on our website. It's a quick link that people can see what opportunities. There are often several opportunities to serve as an ESC member. People can learn about that opportunity and register their interest there. We also do send out notices through general and then subject matter based listservs. So we will be sending out correspondence through our listservs. There's a regulation revision, I hope I'm getting the name right, listserv that people can sign up for to register their interest in participating in this process in general. And we will also, send out through that listserv. And as I mentioned, we'll keep our website updated with that information as well.
So one request that I would make, actually two. One is that I would love if there was a blurb that you could just send out to us with a link, so that all of us who have newsletters and have communities of interest in the areas that we work with can get that information. I think that would be really helpful. And then the second is that, as you're moving through, even as you're starting to onboard or consider executive steering committee members, I would be asking them a little bit about, can they send this out to their bases too? Because I think one of the opportunities that Allison, see you trying to take advantage of is the fact that we do have a lot of people who are really interested in the work that you're doing, but getting deep into the community. So it really does reflect the broadest cross section of our community. So that would be my other recommendation. And then we have been working quite a lot in our community, learning a lot about how to be much more accessible and inclusive. And it's everything from multi-languages to sign language to the hearing impaired. And the one great thing about, if you can look for a silver lining in COVID, has really been that being able to use tools like the one we're using now makes things so much more accessible to the public. But not all of our tools are accessible to the entire community. So one recommendation I would make, and we'd be happy to give you some folks who are helping us in Santa Clara County, is that we do have some sort of a liaison or a contract with somebody who can actually make sure that that we're practicing inclusivity, you know, in a much broader way. We're learning a lot about it, so I don't want to say we're an expert. We just now in Santa Clara County launched an Office of Disability Affairs, and through that experience, I've learned a lot about what we're not doing right. So I'm happy to share what we're not doing right with you and save some time for you. And then lastly, that I want to request that the board host virtual listening sessions in the evening per topic, instead of just trying to get everybody on one topic, especially as you see the process unfolding, that some topics may be have a higher level of people that are interested or experts on them. So I'd really like us to not try to squeeze everybody into one or two. And if we make the motion to approve, which I will, I would like those 4 items included.
Great, thank you. Those are fantastic suggestions, and I appreciate them. Thanks.
And I'm so excited to get to work with Judge Lucero. She's amazing.
Oh, good.
And if I may, Chair Penner, this is Katie. Supervisor Chavez, if we could be sure, maybe we could get your 4 additional items. I just want Adam to be able to have the minutes accurately reflect your suggestions.
Will do. We'll send them right over.
Okay. Anything further from the board? Public comment on this, Adam?
Madam Chair, we currently have 4 members of the public who wants to comment.
Okay, and then we'll close the queue following the beginning of the public comment.
Okay, the first one is Nancy Juarez.
Hello, Nancy Juarez, Center on Juvenile and Criminal Justice. We want to comment on the Bscc's minimum standards for local juvenile facilities. Overall, the Bscc inspections are only as good as their standards. As Allison shared, revisions should be informed by real-life experiences from those who know firsthand what needs to be improved. This can be accomplished with at least half of the executive steering committee consisting of impacted people and their families, advocates, and community-based service providers. A person formerly involved in the justice system should lead or co-lead the ESC. To reach such applicants, there needs to be strong outreach about the ESC application process and deadline. For example, the Bscc should host a webinar at least a month before the application deadline. The Bscc should do targeted outreach to orgs outside of their current network and listserv, especially orgs that work to get people who are formerly incarcerated connected to jobs. In order to improve the minimum standards, the Bscc must improve the public comment period so that it is accessible and inclusive. Concrete steps include immediate outreach to youth inside juvenile facilities. The Bscc should collect feedback from youth who rely directly on minimum standards to keep them safe every day. This can be done through administering a survey to both youth who have been and are currently housed in these facilities. Unlike past surveys, outreach needs to happen early. It needs to protect youth confidentiality and encourage honest feedback. To ensure this, the Bscc should contract a community-based org that works directly with impacted youth. Moreover, the process must be accessible to the community. Listening sessions and public comment periods should be virtual and hosted during evenings to account for work schedules. At the very least, the Bscc should host 1 listening session per working group topic. Thank you.
Next, we have Miguel Garcia.
Thank you. Good morning, Madam Chair and board members. My name is Miguel Garcia, State Youth Justice Specialist with the Anti-Recidivism Coalition. As someone who served on the Minors in Detention Work Group for the Adult Title 15 and 24 regulations, I communicated my lived experience to improve that regulation. Having participated in this process brought to light the need to enhance the involvement of additional community members for this year's juvenile justice title regulations. For these reasons and more, we urge the Bscc to create an executive steering committee that includes a balance of those with lived experience, service providers who work with impacted youth, community members, and advocates. This representation will ensure that revisions are based on real life experience from those who know firsthand what needs improvement. At least half of the executive steering committee should be community-based service providers and individuals with lived experience. A person formerly involved in the justice system or a community service provider for youth involved in the justice system should co-lead or lead the ESC. Thank you.
Thank you.
Next, we have Aditi.
Hi, Aditi Sharkar again from Children's Defense Fund, California. First, I just really want to appreciate Allison's commitment to enhancing the public comment process and for recognizing the time, or for recognizing that we need time and diligence on how best to make it accessible and inclusive. It's so critical in this process to be thoughtful about this. So I just, again, really want to express my gratitude to you, Allison, and also Supervisor Chavez for the commitment. I want to echo some of the suggestions that were already made around ESC membership and making public listening sessions more accessible. I think there were really good lessons learned from last time around. And this a thread that I see coming through with these comments is the need to really contract and work with CBOs. I think that would be a great way for the BSCC to make sure that, you know, for example, any surveys that are done inside are done by people who the youth trust. In facilities, we know young people often really worry about retaliation, and it's hard for them to be candid. And so working with those that the youth already have relationships with to solicit their feedback, solicit what needs to be changed in the facilities could be a good way for the BSCC to get, you know, the right information in a way that protects the young people too. We really are concerned about young people having a voice in this process, and their needs really need to be centered because, as others have said, that this is what they have to live with every single day while they're incarcerated. So they really do know best. And also working with community organizing groups and community-based organizations to solicit public comment from the community who is also impacted. I think, you know, they really know their base well. Supervisor Chavez said this as well, and they can be a tremendous resource to the BSCC. So I really encourage the BSCC to rely on these groups and to rely on advocates and community to help you inform this process. And please do take seriously the suggestion for a balanced ESC. It would be excellent if a young person with experience could co-lead it. Thank you.
Thank you.
And lastly, we have Next Generation Fellowship.
I thought we already heard from the Next Generation Fellowship. Am I mistaken?
I do not know. We do have one more, Jason.
Well, I don't want to overlook if it's, I just thought it might be repetitious, but.
Hello, everyone. This is Nancy Juarez. I was logged on under the wrong Zoom account. Sorry about that.
It's all right. We allow that. Wait, watch the chair. She'll make plenty of mistakes, so you feel good about that. Go ahead.
And that would be Jason.
Oh, wait. Did we?
We already heard from Nancy,
Sorry,
Madam
I
Chair.
apologize. I apologize.
So Jason, are you out there?
Yes, can you hear me?
Yes.
Wonderful. Good morning, Madam Chair and board members. Jason Piazza here. I'm the jail commander of Sutter County Jail. I can speak specific to our facility, but I do keep in contact with jail commanders in the North State, and we are all facing the same issues and generally speaking, handle issues in the same fashion. I wanted to address COVID in our facilities. We have been very successful in keeping COVID out of our facility by screening incarcerated people and staff, requiring masks and weekly testing of staff who are not vaccinated. It is important to remember one may contract COVID even if that person has been vaccinated. We have had some minor outbreaks and have responded immediately to eradicate the virus from our facility. In reference to the earlier public comment, it is necessary to isolate or quarantine new intakes or anyone who is positive in order to not allow that virus to spread to other people. I assure you and the public, incarcerated persons' safety is of the utmost importance, and no administrators want to create any safety issues in their facilities. Lastly, I wanted to express my appreciation to the board for the work you do. Thank you.
Thank you.
Madam Chair, that concludes public comment for this item.
Thank you. Anything further from the board? Cindy?
Thank you. I do have just a question. I really like the idea of a third party being able to assist with surveys. And we've done that in our facilities, and I found it to be very helpful. Is that a practice we currently have?
I don't believe we have a third party helping with surveys in the facilities. Allison, want to speak to that?
I believe that the SAC-J, that has a separate stream of funding, has done a survey. I know just about enough to be dangerous, but we in the regulation revision process have never contracted with anyone to do surveys.
You
So,
know,
I actually, I have a response to that. I co-chaired the last round with Michelle Brown from San Bernardino. We did have a survey conducted privately, funded by the California Endowment of Youth, that was very interesting and useful in terms of all of the issues we were addressing in the revision process. So while Bscc may not have contracted, there's no barrier, and in fact, you know, there's a wide open door for surveys to be done by outside parties or interested groups and to submit them as comment.
Thank you, David, for reminding me about that. I remembered that that survey was conducted and privately funded.
what I wanted to recommend is that in addition to the points I raised earlier, if staff could look at how to facilitate that third party process, and really what I would be looking for is the opportunity to create the safe space that, you know, so that folks can, young people will be able to share their voice. And I would put that in the hands of the steering committee to make a final decision about the what and the how of that, but I want to recommend that directly to the committee, if that's the appropriate way to do that.
I think it's more than appropriate and a good idea on top of that. So thank you.
Thanks. And I would make that a motion to move staff's recommendation with the 5 additions that I've requested.
Okay.
David Steinhardt will second.
Thank you. We got a motion, a second. Adam?
Chair Penner,
Aye.
Miss Allison,
Aye.
Mr. Gradden,
And just so you know, like, I keep cutting off and getting dropped. I have bad internet up here, so I'm going to keep my video off in hopes that that helps.
Mr. Haynes,
Aye.
Miss Vernon,
Aye.
Miss Guard,
Aye.
Mr. Mills,
Aye.
Mr. Budnick,
Aye.
Mr. Steinhardt,
Aye.
Miss Kumpion,
Aye.
and Miss Chavez.
Yes.
Madam Chair, the motion carries.
Thank you. Thank you for all the input and participation. And thank you, Allison, as you begin this lengthy, heavy lift. We appreciate you. Moving right along now to item F, that we have Tanya Thompson, who will be presenting on the Adult Reentry Grant Cohort 3. Before we begin, Aaron, any conflicts we should address prior to starting this item?
Yeah, I believe on this one, we would look to Ms. Kumpion and Mr. Budnick to recuse themselves before discussion of this item.
Okay, they're going to get a strategic quick break. Does anybody else need a quick break, or you want to forge through and then maybe log on and off as needed here? Okay, we will not take a formal break, but we do allow you to, sneak away for a few minutes. Not as long as those who have recused themselves on this item, let me say. Tanya, are you out there and ready to present?
Yes, ma'am, I am.
Thank you.
Good morning, Madam Chair and board members. My name is Tanya Thompson, and I am a field representative in the Corrections Planning and Grants Program Division. I am here to present agenda item F, which requests approval to release the Adult Reentry Grant Program Cohort 3 Request for Proposals, or RFP. The Adult Reentry Grant was established in the 2018 Budget Act to provide funding for community-based organizations to deliver reentry services, excuse me, for people formerly incarcerated in state prison. To date, 115 projects have been awarded approximately $106 million in funding to provide rental assistance and warm handoff and reentry services throughout the state. The Budget Act of 2021 included $67 million to continue funding rental assistance and warm handoff and reentry services. Just under $32 million is available for each component of the BS, and the Bscc will retain 5% for administrative purposes. An executive steering committee was formed and convened on November 8th and 9th of 2021 to develop the RFP that is now provided for the board's consideration. Madam Chair, I would like to take a moment to thank Chief Kelly Vernon for serving as the Executive Steering Committee Chair and guiding this process. Thank you so much, Chief Vernon. Key RFP highlights include eligible applicants must be community-based organizations. Applicants may apply to provide rental assistance, warm handoff and reentry services, or some combination of both. Applicants may request up to $2.7 million for rental assistance projects, and applicants may request up to $750,000 for warm handoff and reentry services projects. Applicants proposing projects that include housing or housing-related services must adhere to the principles of Housing First, and successful projects will be funded for 42 months. So we're looking at a 42-month grant cycle, and there is no match requirement for this project. Subject to board approval, this RFP will be released on Friday, February 11th. Proposal applications are due April 8th, and staff anticipates a return to the board in September to present funding recommendations. In summary, staff recommends that the board approve the release of the Adult Reentry Grant Program Cohort 3 RFP. This concludes my presentation, and I am happy to take any questions you may have.
Thank you, Tanya. Anything from the board?
I just want to thank Tanya and Bscc staff. This was an incredible experience, and it's a really exciting prospect to get this money in the right hands to do good work in our communities. So thank you, Tanya, and to all staff who led this effort.
Absolutely, Kelly. This is really a good news story that we're on cohort 3 of this, and the good work that's being done out there. Anything further?
I do have a quick question. How does this overlap with some of the other initiatives as it relates to one example in particular is Cal Ames that's stepping in to do warm handoff services and in reach into the institutions prior to release to make sure the population is set up with appropriate services upon release.
Your question is, how does this project overlap with that? Go ahead.
No, yeah, go ahead. That's it.
The best thing I could suggest or recommend is that the way that this project will provide opportunities for those similar types of services. And so when those community-based organizations apply and are awarded that funding, they can absolutely do those types of activities in reach into the facilities and, providing those types of services. That would be the closest thing that I could see to overlap in terms of just the types of services that are being provided, unless there are organizations that are participating in both of those projects.
And maybe I need to be more, I need to be clear on my question. So, for example, when you talk about warm handoff, to me, that means setting up everybody with the services that they need, right? To include potential application for Medi-Cal or Social Security. So is that what you're talking about when you talk about warm handoff services?
Pretty similar, yes. Within the RFP, the ESC did get together and provide some specific definitions for warm handoff and for, excuse me, rental assistance to be really clear on how those different pots of money, what types of activities those pots of money can fund. There are some sample eligible activities located within the RFP. And additionally, the ESC did not get too proscriptive with regards to which activities could be funded. The thinking behind that process was really to allow the organizations that are applying to be able to create those services that will best meet the needs within their identical or their individual, communities.
Thank you.
You're welcome.
Thank you. Anything further from the board? Seeing none. Adam, do we have public comment on this item?
Madam Chair, Mr. Haynes has.
I'm sorry. This, I'm never going to get good at this Zoom. Go ahead, Kirk.
No problem. Tanya, just a real quick question. Based on the prior cohorts for this funding, are the recipients allowed to subcontract some of those services, or is that a part of the ability for them to have that kind of flexibility?
Yes, absolutely. They do have the opportunity to contract with other non-governmental organizations to provide those services.
Okay, great. Thank you. Just
Seeing no other hands, Adam, public comment.
Madam Chair, we don't have public comment for agenda item F.
Thank you. Then I would look for a motion and a second, please.
I'll move it. Somebody's got to move it. I'll move it.
Thank you. And a second?
I'll second.
Thank you. Adam?
Chair Penner?
Aye.
Ms. Allison?
Aye.
Mr. Graven?
Aye.
Mr. Haynes?
Aye.
Ms. Vernon?
Aye.
Ms. Guard?
Aye.
Mr. Mills?
Aye.
Mr. Budnick recused. Mr. Steinhardt?
Aye.
Ms. Kumpion recused. And Ms. Chavez?
Yes.
Madam Chair, the motion carries for agenda item F.
Thank you. Thank you. And my thanks also to you, Kelly, for your hard work on this. And of course, Tanya, as always, efficient and professional. Thank you very much.
Thank you.
Moving on, can we get our recused members back? Anybody want to run over and find Scott and Norma, please? Although, as we move to item G, the Prop 47 grant evaluation reports on cohort 1. Oh, this is the report out. It's not an action item. Okay, we're preparing for that.
Here comes
Stacy?
Scott.
There's Scott.
Hi, Scott.
Good morning, Madam Chair. This is Stacy.
How are you, Stacy?
I am doing well.
Good, good. Stacy's worked hard on this report out. I think all of us who have been around for any amount of time recognize the Prop 47 grants and how expansive and inclusive that endeavor was. And I'm looking forward to seeing a report out on how cohort 1 went. So Stacy, you may take it from here.
Okay, I'll just share my screen here. Maybe. Okay, can everybody see that now?
You need to switch your view. So go up to display settings to the top. The drop down in the top left-hand corner.
Of the, oh, okay, I see where I'm at. Okay.
And then you're just going to swap. There we go.
Perfect. Thank you, Sean. I appreciate that. Okay. Good morning, Madam Chair, members of the board. My name is Stacy Riley. I'm a research data specialist in the research unit at the Bscc. And today I'm going to be providing you with an update on the Prop 47 grant program. Specifically for cohort 1, I'm going to provide you with some demographic information as well as recidivism data. In cohort 2, I'll be providing demographic information as well as some preliminary outcome data on grantees' progress through September 30th of 2021. The Prop 47 grant program that the BSCC administers is designed to serve individuals that are involved in the justice system and have a history of mental health or substance use disorder. We have 2 cohorts of Prop 47 grantees. Cohort 1 recently concluded, and for cohort 2, we put forth an RFP that was similar to cohort 1 with some minor modifications. And one of the modifications included an enhanced data reporting procedures, which included common data elements across grantees and de-identified participant level data. These enhanced data reporting procedures are allowing staff to better tell the Prop 47 statewide story, track participant services and outcomes, and better identify potential technical assistance needs of grantees early on. So start off talking about cohort 1. We received 58 proposals requesting $225 million and funded 23 proposals for a total of $103 million. And we're going to jump right into the recidivism information and findings. AB 1056 provided a definition of recidivism, which you can see on the screen. And all grantees were expected to report recidivism rates of their participants using this definition. There were variations in the grantees' reporting of the recidivism rates. So some grantees reported rates based on a specific period of time, such as 12 months after program completion. Others reported an overall recidivism rate, which was just the percent of participants who received services and were later convicted of a new misdemeanor or felony. Some grantees had multiple service tracks, and recidivism rates were reported separately for the tracks. As such, recidivism rates cannot be calculated for cohort 1 participants at the statewide level. And so we are going to be presenting the recidivism rates by grantee. Note that while some of the grantees obtained statewide data, most grantees obtained data from local law enforcement agencies, so convictions in other counties may not have been captured in this data. When examining recidivism rates across grantees, it's important to note that the target population varied by grantee, and some grantees focused on target populations that were more challenging to treat, such as individuals with severe mental illness, dual diagnoses, or a long history of drug use. Also, the types of treatment programs varied by grantee. As such, when comparing recidivism rates across grantees, it should not be made without the additional details about the target population and the program of each grantee. And this information can be found in the grantee's final local evaluation reports, and those are posted on our website. So the following grantees reported recidivism rates based on the amount of time that passed after completing the program. And this ranged from 6-month follow-up to 24-month follow-up. Almost all of the grantees had recidivism rates below 25%. For comparison, recently published statewide reports by PPIC and CDCR put the reconviction rate in California around 35%. So these data indicate the participants who have completed program requirements may be less likely to recidivate. Now, San Diego County is a good example of why you cannot compare recidivism rates across grantees, and also why conviction rates alone may not be the best measure to assess program success. San Diego selected a target population that has multiple challenges and are at very high risk for recidivating. Both of their programs focused on individuals with substance use disorder and a long history of multiple justice system contacts. For example, their SMART program participants had an average of 8.2 arrests in the 2 years prior to program enrollment. Compare that to the 2 years after program enrollment, the number of arrests had dropped to an average of 5 for those same individuals. So the conviction rate clearly does not demonstrate that improvements were made. A review of their local evaluation report shows a decrease not only in arrests, but also in bookings and in convictions of program participants. Bscc staff are currently preparing a statewide summary report for cohort 1 that will include additional details and will be released in the near future. This list of grantees include those who reported an overall recidivism rate, and that's just the percent of individuals who received services and were later convicted of a new felony or misdemeanor. For all of the grantees, recidivism rates were below 20%. And when you compare that to recently published statewide reconviction rates of 35%, these data indicate that participants who completed the program requirements may be less likely to recidivate. While these recidivism rates are encouraging and do appear to indicate that Prop 47 programs are effectively reducing recidivism rates for participants, we are not able to state conclusively that this is true at the statewide level. And the reason for this is that the Bscc does not have the data available that allow us to conduct the necessary statistical analyses and compare cohort 1 participants to an equivalent comparison group. Now, at the local level, some grantees reported the results of these types of analyses in their final local evaluation reports. And for those grantees, they can make stronger conclusions about their program's effectiveness at reducing recidivism rates in their participants. One example of this is Orange County. If you look at their final local evaluation report, you'll see that they looked at not only conviction rates, but also arrest and incarceration rates. And in all categories, the recidivism rates were statistically lower for participants who received Prop 47 services relative to a matched comparison group. So these analyses allow Orange County to draw strong conclusions about the effectiveness of their programs at reducing recidivism rates. With the enhanced data reporting procedures implemented for cohort 2, staff will be able to conduct analyses at the end of the grant period that will allow us to make stronger conclusions about the effectiveness of the Prop 47 programs at reducing recidivism at the statewide level. A little more information about the cohort 1 participants. Just over 32,000 participants received services. 50% were, over 50% were between the ages of 26 and 43. Most of the participants were male. 39% were Black, 31% were Hispanic, and 26% were white. Grantees were required to provide mental health services, substance use disorder services, and/or diversion programming services. And this chart shows the number of participants who received these services by quarter. In cohort 1, some grantees reported mental health and substance use disorder separately, and those are represented by the dark blue and light blue bars respectively. Other grantees combined these services into one category, and that is reflected by the gray bar. The yellow bar reflects the number of individuals who received these diversion programming services. If you look across the duration of the grant, you will see that it took programs time to start up. And to provide some additional context, the pandemic that caused the state to shut down in March of 2020 occurred at the end of quarter 11. The last 4 quarters on this graph were the no-cost extension. One grantee did not take the 1-year no-cost extension, and some grantees used up their funding and stopped serving participants prior to the end of the no-cost extension. So these factors likely accounted for the drop in number of participants receiving services at the end of the grant. Note that these are not unduplicated counts. The participants may receive more than one service, and the participants may receive services for more than one quarter. Also, this does not measure dosage. The data indicate that the participant received these services during the quarter, but not how frequently. This graph shows the number of individuals that receive support services by quarter. And there were 5 different categories of support services that we tracked with cohort 1. The dark blue is case management. Employment services is light blue. That include things such as job training, resume development. Housing is light gray, and that includes services such as motel vouchers, transitional housing, and rental assistance. Legal services is the dark gray. That included things such as expungement of records and reclassification of Prop 47 convictions. And yellow is the other category, and this includes a wide range of services that some grantees reported but were not consistently tracked across all grantees. This included things such as assistance with food or other basic necessities such as hygiene kits or clothing, education services such as GED prep, and transportation services such as bus passes and Uber rides. Moving on to cohort 2, the Bscc received 43 proposals requesting $194 million. 23 grantees received funding for a total of $96 million. Just over 5,300 participants have received services during the first 2 years of the grant. And this chart shows the number of participants served by quarter. Again, note that in this chart, these are not unduplicated counts, as the participants may have received services for more than one quarter. To provide some additional context in this chart and the next couple of slides as well, the first quarter was an implementation period. Grantees were not required to serve participants during that quarter, but some were able to start with that process during that time period. COVID-19 caused the state to shut down in quarter 2. Looking at the participants, the majority of them were male. Half were between the ages of 26 and 43. 43% are Hispanic or Latino, 34% white, and 19% are African American. Also, at the time of program enrollment, 37% of participants were unhoused, 24% were living with family or relatives, and only 18% were living independently. Also, at the time of enrollment, 69% of participants were unemployed and only 13% were employed full-time. Looking at the 3 required services provided to participants, the yellow represents substance use disorder treatment, the number of individuals that received it during that quarter. Gray is the mental health treatment that was provided to participants. Blue represents the diversion services that were provided to participants. And as with cohort 1, these graphs are not unduplicated counts. We expanded the categories of support services that we're tracking with cohort 2, starting at the very top with the lightest yellow. That includes assistance with food, followed by basic necessities, case management, education services, employment services, housing services, legal, social services, which includes things such as applying for Medi-Cal or CalFresh, transportation services, and other support services is the darkest blue. Other services that were frequently cited included things such as healthcare that was not mental health, family services, including things such as reunification or parenting classes. Now, all of the data that I've presented this far for cohort 2 are available at the statewide and the grantee level on the Prop 47 cohort 2 dashboard. This is located on the Bscc website at the bottom of our homepage under other useful links. So you can see how each grantee is providing services and what services they are providing on that page. At this point, it's too early to evaluate the effect that these programs have had on recidivism rates, but we do have some other preliminary outcome data for participants that were enrolled and have completed program requirements. Starting with housing status, this is a subset of participants. These are individuals, as I said, have enrolled and completed the program requirements. And this does not include individuals who just received one-time intervention services, such as a sobering center. These individuals indicated that housing was a goal for them. And we also had housing data available both at program enrollment and program completion. The yellow bar on this chart reflects the percent of individuals indicated their housing status category at the time of enrollment. And the blue bar reflects the housing status of participants at the time of completing the program requirements. A couple of highlights to point out. The number of participants who were unhoused dropped by nearly 60%. And the number of participants living independently increased nearly 50%. Looking at employment status, and again, these are individuals who enrolled in and completed the program requirements. They indicated that housing was a goal and that we have employment data available both at program enrollment and program completion. Again, the yellow bar represents the status at enrollment and blue is at completion. A couple of points to highlight. Unemployment dropped by approximately 1/3 while participants were enrolled in the program. And the number of individuals who were employed full-time more than doubled. Again, although it's too early to examine recidivism data in the participants, these preliminary outcome data on housing and employment status suggest that progress is being made in the cohort 2 grant cycle. And at this point, I'm happy to answer any questions from members of the board.
Anyone from the board have questions of Stacy? No questions, Stacy, but gratitude. Thank you.
Oh,
thank you.
Oh, wait, Norma.
I don't have a question. I don't have a question. I just have a comment. Stacy, thank you very much for this presentation, but I thought that this was amazing. And this is very exciting. This is very exciting news. And I'm just really happy that these are the preliminary findings. I'm super excited about this. So thank you. And thanks for your presentation.
Thank you, Norma. I appreciate that.
I agree. Anybody else from the board? And the good news is more money to come here, as you will hear soon.
Madam Chair, this is Katie. If I may jump in, I want to acknowledge, and I know it's absolutely evident from what Stacy has just presented for the last little while here, so much work has gone into building a data collection system. Stacy has worked tirelessly. This is what she spends the very vast majority of her time on, is working with grantees, collecting data, analyzing data. I really, truly appreciate Stacy's professionalism and diligence. She's super careful about what conclusions we can appropriately draw right now and what will require additional research and data. But nonetheless, when you see what Stacy has presented today about the important progress that can be demonstrated in things like changes in employment status, changes in housing status, and quite simply and directly, more services and interventions received for mental health treatment and substance use disorder treatment, there's a great deal of good news in here. A huge shout out to Stacy for all the work that she's done, and also very, very importantly to the Prop 47 grantees who have been working so hard for the last several years. And many of us have wondered, okay, what's going on? What progress can we talk about? So really, this is the first time we've been able to bring this level of detail of an information report to the board. I agree with you, Norma. It's super exciting. It's super encouraging. There is more to come. And I just really want to thank you, Stacy. This has just been a major, major effort on your part, and we appreciate it.
Thank you, Katie. I really appreciate that.
Good data goes a long way for good outcomes, I think is really the important piece of the story to remember. Anything from members of the public on this item?
Madam Chair, there are no public comments for this item.
Okay, then I will thank you, and we will move on now to item H. And I see Damien on board now, and he will be presenting on cohort 3 RFP.
That's a tough one to follow, but oh, sorry.
Sorry, Damien. I always
No.
forget Aaron and recusals. It's how we roll here at the Bscc.
Yeah, I need to check on recusals, Madam Chair, and I want to make sure that we have enough members available to vote on this item if we do those recusals. So do we have recusals of people who want to recuse at this time?
I can tell you that Chief Mills had to leave. He had a meeting, so he is no longer with us.
And I'm Chavez recusing at your recommendation.
Thank you, Supervisor Chavez. Anyone else?
Chief Haynes will recuse from this discussion as well.
Thank you, Chief. I'm counting the boxes left on my screen.
Sorry, I'm gonna have to recuse myself also.
All right. 1, 2, 3. Norman Scott, do ARC do services under Prop 47?
Not funded currently, I don't think, with funds under Prop 47, but we do substance abuse services.
And I don't know for sure on if there's been any subcontracting at that level. Damien?
I'd say probably better safe than sorry.
Okay, we'll say better safe than sorry, which is always good. And then I have Norma. Now I've got a problem.
Draw lots.
1, 2, 3, 4. I've got 4 left.
You have 5. You have Penner, Allison, Guard, Vernon, and Steinhardt.
You have 5.
I have 5. I need 1 more so we can get to 6. Majority of those present and voting. So this is what I'm going to do. I'm going to draw lots real quick. And I'm going to do this as a random number generator. So I have Groudon as 1, Chavez as 2, Haynes as 3, Budnick as 4, Ms. Kupion as 5. What we are doing here is we're invoking what is known as the rule of necessity. We have a statutory obligation to do the Prop 47 program, and because we don't have enough members available to vote on this proposal in order to get out in the field, we are going to draw lots randomly in order to allow a suitable number of people present to vote on this item. And so I'm going to click over on my other screen. I'm going to generate a number, and I have number 5, which I indicated was going to be Ms. Kumpion. I'm going to ask Ms. Kumpion to come back and vote on this item if she could. But she may have taken the opportunity to go away and take a break.
Let me see if I can shoot her a text.
And I think you can start presenting, Damien, if you want to do that as well.
Can I ask a silly question? It appeared to be all of the contractors were in some form, mostly county agencies, whether mental health or public health or a variety of things. So is the concern that they may subcontract with one of these organizations?
There is for board members Kumpion and Budnick, who are either employed or closely affiliated with the Anti-Recidivism Coalition. There's a outside concern that they could get subcontracted. And even that, we want to make sure we're diligent about making sure they don't participate in decisions where that funding might flow to those organizations, even if they don't know about it at this time. Again, it's an outside chance. They're not currently providing services from what we've understood. Thank you, Ms. Kupion, for returning. And I think if that answers your question, Secretary Allison, I think we can proceed.
Yes, it does. Sorry.
Thank you.
Hello. Hello.
We allow having lunch, Norma.
Hello.
Yeah, who's that?
Who's talking?
And there we go. Marcus was in and he's out. Okay. All right.
I don't, sorry.
Damien, I really believe we're ready now. Miss Kupion has forgoed her. We would like you to keep eating, Norma.
I don't know if that was me that started all that, but that was a long introduction. So thank you very much. On a side note, it's been exceptional working with Stacy. So to follow that is difficult. And at the same time, I get to say, fantastic, here's some more money. Let's do this again.
Yeah.
I'm also excited that this is my first grant from start to finish with Bscc. So that's really exciting for me. So good morning, Madam Chair, members of the board. My name is Damien Renaud. I am the field representative presenting for Proposition 47. Today, I'm presenting agenda item H, Proposition 47, Grant Program, Cohort 3, Request for Proposal. This agenda item requests board approval and release of the proposed request for proposals for the third round of Proposition 47 grant as recommended by its Executive Steering Committee. The RFP and the ESC roster are included in the board item attachments. This grant agreement covers September 1st, 2022 to June 1st, 2026, and approximately $143 million is projected to be available, with up to and about $6 million, as we see it currently, additional dollars that reverting from cohort 1. A few key components and some of the changes to the RFP this year from previous years include things such as, and I apologize, I should have started this, and if I can take a quick step back and just share my screen, so my apologies there. There we go. So again, some key components that are a bit different are a modified and expanded existing guiding principles, some of the language to ensure that non-governmental aid organizations that receive Prop 47 grant funds have been in good standing for at least 3 years. That's a bit different from the last, for the previous RPs. This round, the total grant period extends 45 months, providing 6 additional months for ramp up and final reporting. And then finally, one additional one that we thought was that the ESC believed was a good idea were an extension, a 1-year extension for cohort 2 grant, for the cohort 2 grant period, or the ability or option to apply for cohort 3, so the either or scenario. Some key dates that I'm presenting here are, we're hoping to release the RFP into the field this month here over the next few days. The proposals will be due back to the Bscc in May of 2022 this year. And then we're hoping once again that grants will begin in September of this year as well. I would like to take the time to thank and acknowledge Judge Janet Gard for her leadership and support in the development of the ESC as well as the RFP. At this time, our recommendations on behalf of the Prop 47 Executive Steering Committee, staff recommends the following. The board approve and authorize the release of the RFP as recommended. This concludes my report, and I'm available for any questions.
Thank you, Damien. I appreciate that. Looking to the board for any questions or comments. Adam, any members of the public?
I do not have any public comments at this time.
Okay, thank you. So I need a motion and a second.
I will move approval of the release of the RFP.
I second it.
Thank you. Adam?
Chair Penner,
Aye.
Ms. Allison,
Aye.
Mr. Groudon recused, Mr. Haynes recused, Ms. Vernon,
Aye.
Ms. Gard,
A resounding aye. With Thank you to Damien and Stacy and Veronica and Ricardo, who were phenomenal in preparing the ESC to have really thoughtful discussions and produce a product they were very proud of. So aye for me.
A.
And Mr. Mills is not present for this vote. Mr. Budnick recused. Mr. Steinhardt?
Aye.
Ms. Kumpion?
Aye.
Ms. Chavez recused. Madam Chair, the motion carries.
Thank you. Thank you. And thank you, Janet, for your hard work on this. We spoke before the meeting started, and even without any public listening to her comments, she was effusive about how great the process was. And I say that loud and clear so all board members can remember when you're asked to step in and run an ESC, it's a fabulous way to spend your extra time. So thank you for all your hard work, Janet and Damien and Aaron, for your quick straw vote. That was very impressive. And we'll invite all of the recused members back. Because Katie's much more sensitive and caring than I am, she has asked if anybody needs a 5-minute break. As I say that, you can see by the way I present that question that I'm not in favor of that. I think we should continue to move through and have people come in and out as needed.
Sounds like a no.
Well, I'm just expressing my opinion. So I think we'll move forward. Looking for Dean, you're there, but you cannot be on camera. Supervisor Chavez. Oh, you are on camera now. Scott Budnick, looking for you. All right. Somebody's got some music, some vibes going, but we're going to go ahead. Katrina, I expect those board members will be back soon.
All right, good morning. I'm going to share my screen. Right. Good morning, Madam Chair and members of the board. My name is Katrina Jackson, Field Representative with the Corrections Planning and Grant Programs Division, and I am here to present Agenda Item I. Agenda Item I requests your approval to develop service contracts and supplemental grants for technical assistance to expand capacity and provide training for the CalVIP program. The State Budget Act of 2021 included $1.8 million in funding to promote and build capacity in the field of community-based violence intervention and prevention. Programs could include activities such as contracting with or hiring technical assistance providers, contracting with or providing grants to organizations that provide training and certifications to community violence intervention and prevention professionals, and contracting with independent researchers to evaluate the impact on selected initiatives supported by CalVIP. The CalVIP Executive Steering Committee was convened and recommended the $1.8 million be allocated to 5 categories. Category A will receive $750,000 to provide training to community-based violence intervention and prevention professionals to expand the field of frontline workers. Category B will receive $500,000 to provide supplemental grants for CalVIP grantees to provide mental health services to frontline workers and their families to help deal with stress and trauma on the job. Category C will receive $250,000 to provide regional technical assistance to build capacity in data collection, data entry, development of data sharing agreements, financial and billing needs, accounting, communication support, and fiscal structure. Category D will receive $150,000 to convene specific strategy meetings that would bring together the entire cohort to identify and share best practices. And category E would receive $150,000 to institute a culturally relevant professional development pilot program for frontline workers. In closing, staff recommends the board approve the $1.8 million to develop and the listed service contracts and supplemental grants. Are there any questions?
Looking to the board, any questions, comments?
Yeah, David has a question.
Okay.
So Katrina, what wasn't clear in the presentation is how the contractors would be selected. Is that by the staff working with the ESC, without the ESC? What is the sort of application and choosing process there?
There will be an RFP process for each category. So then service contractors would reply to the RFP. And then I believe, and Ricardo, correct me if I'm wrong, I believe that we will have rating factors within those RFPs, and then the staff will review and rate the proposals.
So it's competitive then?
Correct.
Yeah, for the service contracts, we'll go through the regular state procurement process for that.
And Katrina, this is Katie. Will you take off the screen share so we can see everybody? Thanks. Ricardo, did you have anything to add?
No, I think that was the gist of it. Thank you.
Okay. Seeing no further raised hands, I will ask Adam, are there members of the public that would like to comment on this matter?
There are no members of the public for this item.
Thank you, Adam. Will you take the vote?
Oh, we need a first and a second.
Oh, I apologize.
Chavez.
Thank you. Second?
Second.
Got a first and a second. Now we'll take the vote.
Chair Penner,
Aye.
Miss Allison,
Aye.
Mr. Groudon,
Aye.
Mr. Haynes,
Aye.
Miss Vernon,
Aye.
Miss Guard,
Aye.
Mr. Mills is not present for this vote. Mr. Budnick,
I missed it, so I'm going to abstain.
Mr. Steinhardt,
Aye.
Miss Kumpion,
Aye.
Miss Chavez.
Yes.
Madam Chair, the motion carries.
Thank you. And thank you, Katrina, for your work on this. And we're moving now to item J, the strategic plan, the 2022-2026 Bscc plan. John Prince and Tanya Parker Mashburn. I see Tanya, there we go. John has taken over the screen. Do we have any voices out there that would like to talk about this? John?
I was on mute there, sorry.
There you go. How'd it go for you while you were on mute? Nobody disagreed with anything you said while you were gone.
We're good. Move on to the vote. Okay. Good morning, Madam Chair and members of the board. My name is John Prince, the field representative with the Corrections Planning and Grants Program Division. I'm here to present agenda item J with my partner, Tanya Parker Mashburn. This agenda item requests approval of the Bscc 2022-2026 strategic plan, which will be in effect for 5 years, retroactive to January 1st, 2022, and ending December 31st of 2026. Public comments and staff input were sought throughout this strategic planning process and were considered when developing the organizational goals and objectives. And a summary of those comments can be found on attachment J2 in your binder. As you see, previously on June 10th, 2021, the board considered the draft goals and had an excellent discussion. The board provided further input to staff on desired changes, and on June 21st, the Bscc held a public virtual listening session to review the draft organizational goals and garner input on the objectives. Feedback from those comments received from the board and management team, staff, and public were considered, and the final recommendations are being presented for the board's consideration today as attachment J1. And that is shown here, which is the proposed strategic plan. Following the board's approval of the 2022-2026 Bscc strategic plan, the next step will be the development of strategies by Bscc staff. The staff plans to draft these organizational strategies and performance indicators to deliver on the objectives. For example, a strategy for objective 1.1 may be to hold quarterly input and listening sessions with the public. To keep the board informed and of the process during the implementation period, Bscc staff will report progress annually. And with that, staff recommends that the board approve the Bscc 2022-2026 strategic plan. And this concludes my presentations. I'm available for any questions. now, Madam Chair, did you want me to leave this up so people can look at it, or would you want me to take it down?
Actually, I think we can take it down and so we can see all the raised hands that I continually miss. That was a very brief presentation on something I know was a whole lot of work. I appreciate your brevity at this late point in the morning, and even more than that, I appreciate all the work that went into that. Looking to the board for any questions or comments. Seeing none, Adam, do you have any public comment on the issue?
I do not have public comment for this item.
Thank you. I would ask for a motion and a second.
Move as presented.
Thank you. Second.
Dean
Second.
Groden.
Thank you. Adam?
Chair Penner,
Aye.
Miss Allison,
Aye.
Mr. Grouden,
Aye.
Mr. Haynes,
Aye.
Miss Vernon,
Aye.
Miss Guard,
Aye.
Mr. Mills is not present, Mr. Bugdick,
Aye.
Mr. Steinhardt,
Aye.
Miss Kumpion,
Aye.
Miss Chavez.
Yes.
Madam Chair, the motion carries for agenda item J.
Thank you so much. We'll now move on to item K. This would be our last formal agenda item for the board. And that's the good news because we took item L earlier. So Allison, you want to move forward with that?
Yes, good morning again, Chair Penner and board members and colleagues and members of the community. My name is Allison Ganter, Deputy Director of the Facility Standards and Operations Division. And I'm going to provide an update on the current inspection cycle of outstanding items of non-compliance using the coding system that we introduced at the last meeting, and then adding the juvenile dashboard to this process as well. I want to remind the board that this process is going to continue to evolve throughout this inspection cycle. As we've talked about, we're bringing on more resources to staff some of these data collection and analysis projects. So you'll see modifications as we improve, enhance, and work through this inspection cycle. I neglected to share my screen before I started speaking, so I'm going to attempt to do that seamlessly. Is my screen shared?
It is.
Fantastic. So I am going to start with the adult items of non-compliance. And this link to the dashboard I'm showing are the links provided in your agenda report. Super quick overview of the codes. Green means they're in a corrective action plan. Yellow and green, yellow and gray means they are working through corrective action, and Bscc doesn't feel that there's a substantial threat to safety and security. And red can mean several things, including no response to the Bscc about corrective action plans, but it can also mean that there is a threat to physical or mental health of the people housed in or working in detention facilities. So I'm going to scroll down a little bit. I can stop or pause or ask questions as we go. You will see that there's been new items added from recent inspections, including the items at the Merced County Sheriff's Department related to the number of personnel there. Those items have been coded red due to the fact that the items of non-compliance represent a threat to safety because of the lack of staffing. So typically, we wouldn't code something that's in the time frame for corrective action red unless there were an issue. So the county has indicated they've submitted their corrective action plan to us within the required amount of time. They do indicate that they're seeking Board of Supervisor funding, support for funding to mitigate this problem. But we are going to, at the end of this report, request that the board request that Sheriff Warnke from Merced County appear at the next board meeting that will be in April. So that is one of the additions. You'll see San Diego County is in corrective action. You'll see updates that field representatives have either gotten from the county or have conducted a site visit to verify and update information related to the items. Del Norte County and Humboldt County have both addressed several of their outstanding items of non-compliance, and you'll see them in the bottom of the report where we have corrected items of non-compliance. They remain in corrective action for several issues, and the field representative is going to be conducting another site visit here shortly to work on those issues. And again, we'll continue to update the board on those items as well. And then we do have several familiar items that remain on our list, coded in those yellows and grays. We continue to follow up with those agencies. At this time, we don't believe that there are threats to physical and mental health. We don't recommend that the board request any of these sheriffs to appear at this time. Again, some are related to completing construction, and the item won't be fixed until that happens. But again, we'll continue to update the board on any progress on those issues. Just a quick scroll down to the items that have been resolved. There are several of them, and they will continue to appear. You'll see Del Norte, you'll see Humboldt that got fixed recently. And then so on down the line, all of the items that have been corrected. You'll see double reporting on Orange County. There was another time where the county was found out of compliance for not serving hot food for a short period of time. That was resolved rather quickly after the notice of non-compliance, and that's why you see some doubles in Orange County. And the rest, again, are items that have thankfully been corrected. So I will switch to the juvenile update, and we'll do the same view there. Give me one moment to switch over to the juvenile. Can everybody see the juvenile status up there as well now? Great. So on the juveniles, the codes are the same. On the juvenile side, you'll note the current item of non-compliance in the San Diego County Probation Department. It is related to room confinement and their policy and practice not being consistent with one another. They have submitted a corrective action plan. They are working with the field representative to correct the issues as soon as possible. Again, they are still in the time frame outlined in the Welfare and Institutions Code. So again, we will continue to keep the board updated on issues related to this, and certainly issues of resolution, or if we need to ask for a determination of suitability. And you will see there in the corrected items, similar to the adult list, Alameda County had been found out of compliance for several regulations in their inspection. It was actually September, October, November of last year. Again, we're just getting this dashboard set up for you, but all of those items were corrected in the time frame outlined in Welfare and Institutions Code, and there are no current items of non-compliance. So I'm happy to take any questions, and based on the information that we've shared, we are requesting that the Bscc board approve the recommendations outlined in the links above. And that includes requesting that Sheriff Warnke from Merced appear at the April board meeting. Thank you.
Thank you, Allison. Any comments, questions from the board?
Reinhardt.
Yes, David.
Allison, so why isn't the LA activity shown on corrected items of juvenile for the 2022 inspection cycle?
So that was I was working on the two items parallel. I'm also managing this database and honestly didn't note it on there. So that will get updated as soon as possible. That was I would say a clerical error on my part not to put it on this dashboard.
So, and then in terms of what you're asking us to approve, are you asking us to approve the status of everything on both sides?
Correct. So in it's kind of easier to look at the juvenile one because there are so many less items here. So the staff recommendation for everything except Merced is similar to the one you'll see at the on the screen. This is where they're at. BSCC staff will continue follow-up, and we are recommending that you do not request any of the sheriffs or chief with that recommendation to appear before the board at the next meeting. It's only indicated for Merced County Sheriff.
Okay. Allison, you want to do away with the screen share?
Sure, I am happy to do that.
There's everybody back again. Any further questions, comments from board members? Adam, do we have any public comment on this item?
Yes, I do have one public comment at this time, and that would be Sarah Kahn.
Thank you. And Adam, please close the queue.
Good morning, members of the board. I'd like to speak to one of the inspection updates regarding Orange County's failure to provide hot food, which is marked as resolved. I've spoken to hundreds of people who are getting sick and suffering from eating moldy and rotting bologna, which has been served meal after meal since the kitchens were shut down almost 2 years ago. I really appreciate that you have looked into this issue, but I'm very concerned about the outcome. After the BSCC notified the OC jails that they were out of compliance with the regulations, which require that they serve a hot meal, OCSD added a single hot item, which was warm soup, which was essentially a lukewarm broth with a piece of tomato or onion in it. This was found to be technical compliance. First, this practice is cruel and extremely dangerous to the health of incarcerated people, and OCSD exploited a loophole, and by doing so, reduced the real intention and weight of the regulations that you all work to uphold into mere formalities. People still report that they're getting denied their medical diets or that they're not being properly provided, that they're experiencing nausea and vomiting and illness from the bologna sandwiches, and that they have high blood pressure or high cholesterol for the first time, and that the food is often served moldy or rotten. Second, OCSD really seemed to understand that because they were allowed to continue this practice, they really weren't accountable to the regulations that you've put in place. Within weeks, they had discontinued that warm soup that they had started as a result of you finding them out of compliance. And it seems like it has just made them act like they do not need to be accountable, or hasn't made them act, they continue to act like they do not need to be accountable. And third, I believe that this inspection process has revealed the urgent need to involve meaningful and open communication with incarcerated people in the inspection process. I know that you all have limited enforcement options, but sheriffs are routinely exploiting that by ignoring your recommendations and then screaming about public safety when you finally threaten a consequence. I feel like this situation echoes the horrible situation that was described earlier in LA County that's happening in juvenile facilities, where probation continues to barely achieve suitability in the 11th hour and then violates the regulation immediately afterwards. So I urge you to read a recent report that came out by the Stop the Music Coalition about the food conditions in the Orange County jails that describes how horrible the situation is there. And I believe that if you look into this situation again, you'll see that they're truly not following the regulations of the BSCC.
Well, thank you, and I appreciate your information.
There are no further comments.
Any further comments from the board? Yes.
Yeah, well, that was a pretty strong indictment. Moldy, cold.
Yeah,
and we're just being asked to look at a long list and approve it all. I hesitate when something like that comes up, and either the staff should rebut what's been said or we should set it aside. That's the way I see it.
Yes, I agree. I think it was a provocative public comment, and I think that as we've done in the past, the staff has taken a hard look at things that we have learned in this open meeting setting.
Linda, can I ask a question?
Okay, I'm sorry. I think Cindy had her. I'm sorry. I want to just acknowledge her first, and then I'll be right there.
Thank you. I just want to say, I think David raises a great point and I would be very interested in taking another look at that. And then the second was a process question. And, you know, so this action would then formally request the Merced County Sheriff to come to meet with us. And what I'm curious about is, given that the sheriffs don't have budget control, do we also reach out to the Board of Supervisors or no?
I would suggest that the sheriff will do that when he is invited to come here.
And I think on this instance, Madam Chair, we haven't drafted that notice quite yet for the request, but I think we would plan to CC the Board of Supervisors as part of that request.
And my additional request would be the county executive.
I think we do.
We can do that as well.
But I also think that it stands to reason that sheriff would quickly contact his board.
Oh, okay. I hadn't been party to one of these before, so thank you. That's very helpful.
Yeah, and I'm sorry, Kathleen.
No worries. I just had a question specific to the allegations raised in the last public comment. Were those previously looked at as part of, or is this something new? I mean, obviously it's a very concerning allegation. So were they previously evaluated for that specific level? One, and then two, are there questions on your audit tool that would have caught that already?
I can see Allison checking some documents there. Allison?
So the nutritional evaluation and the regulations that relate specifically to food services and nutrition they're in Title 15 regulations, but since we are not subject matter experts, the Public Health Department conducts that inspection on an annual basis. So the inspection of those items gets done annually by the county health officer, and we receive copies of those, and that becomes part of our inspection report. What's interesting so to answer the first part or part of that question is, in our inspection, our regular Bscc inspection, we would not necessarily have a checklist that would discuss nutritional requirements, again, because we are not subject matter experts in that area. We'd refer back to the nutritional inspection that was done. This item came to light because of a complaint we received from the ACLU that was very detailed and cited specific examples of hot food not being served in violation of the regulation. And so we went down and conducted what we would call a targeted inspection and spoke with the food services provider, and they did take steps to meet the standard that requires at least one hot food at least during one meal. The regulation itself is very vague. It says hot food. After that, they are meeting technically the minimum standard required. And then we also followed up on it again when we understood there was another allegation of them not serving hot food. We discovered that they were not indeed serving any hot food at that time. Revisited, and within days they were serving hot food again. Our regulations don't go into detail about what that hot food is. It doesn't say that it's an entire hot meal or what that service is. So there can be instances where hot food, hot soup, hot oatmeal, things like that can fall into that. It also has to meet all of the other criteria in the regulations for nutritional adequacy. So I'll take a pause there and see if that answers any of the questions.
Yes, I guess my only follow-up question to that, thank you, would be, do we have the ability to ask the Public Health Department to go back in and look at this specific allegation as it relates to mold?
Yes.
I think we do. And I do know, again, that our team talked with public health and the food services provider down there. But it is something that we can follow up on again.
Madam Chair, Norma has her hand up.
I see that. Norma?
My question is that when you say it was a targeted inspection, when you went, you're saying that they knew that you were coming, right? That's what the targeted means. And so I know that we had spoken last year about the unannounced inspection. So I was wondering if this might be a good time to.
You are reading my mind. And it absolutely is. We've talked about it. We've conducted some unannounced inspections already. This has not been one of them, but it is at the forefront of my mind. If I could say that any clearer, stay tuned.
I think it's fair to say that we all take those allegations very seriously. And we did not waive Orange County's obligation to serve warm food. So it's been the position of this board and the agency not to allow for that. So good conversation, good point. And
well, I'm willing to make a motion that addresses the Orange County discussion, if that would be appropriate at this time. Or how do you want to handle it?
Well, do you want to amend the current recommendation of staff or take that alone?
No, I was going to recommend approval of the staff recommendation to approve the inspection findings, with the exception of Orange County as it relates to food service, which will be judgment suspended pending further investigation.
I think that seems to suffice in my opinion. Aaron?
Yeah, I think that can work.
Okay. We have a motion.
Second, Cindy.
We have a second. Adam?
Chair Penner,
Aye.
Ms. Allison,
Aye.
Mr. Groudon,
Aye.
Mr. Haynes,
Aye.
Ms. Vernon,
Aye.
Ms. Guard,
Aye.
Mr. Budnick,
Aye.
Mr. Steinhardt,
Aye.
Ms. Kumpion,
Aye.
Ms. Chavez.
Yes.
Madam Chair, the motion carries.
Thank you, Adam. We're moving on now to item V, the public comment section of this agenda. This is a time for any members of the public to make any comment on items that may have not been on this agenda. So I would ask members of the public to state their name and where you're from prior to your comments, which are limited to 2 minutes. Adam, how does the queue look?
At this time, I only have one public comment. Please let me know when you want to close the queue.
Well, I think that I'm comfortable with closing it amidst the one individual's comments, and I'm ready when you are.
I have two now. The first one is Greg.
Okay. Greg?
Hi there, can you hear me?
Yes.
Hey there, good afternoon. My name is Greg Miner with the City of Oakland. I'm following up on a written comment I submitted last night. We were one of the Proposition 64 Public Health and Safety Cohort 2 grant recipients. So first I want to say thank you to you all for that award last year. We've reached out to Bscc staff to do a budget modification in light of one of our subcontractors backing out, essentially not having the bandwidth to move forward, and a public safety emergency with caravans of armed burglars targeting our licensed cannabis businesses. And so we've done some public outreach, and we've identified two strategies to utilize these available funds, namely overtime for law enforcement to patrol areas where we have cannabis businesses to deter these burglaries, and an online platform to improve communication with operators and public safety alerts. We submitted a request and Bscc staff denied it. We sent a request for reconsideration a week ago, with essentially the contents of the letter we submitted last night, and respectfully request the board ask staff to review and reconsider that denial. As far as I understand, our request is staff has acknowledged our request is within the scope of the grant, and as outlined in our letter, it's within the Bscc's authority to allow such a change. I think there may be concerns about the fact that this was a competitive process, and can we make a change afterwards? And having overseen competitive processes myself, I sympathize, and I know that can be a challenge, but at the same time, request your reconsideration and support. So thank you very much.
Thank you.
And lastly, we have Nancy Juarez.
Nancy Juarez, Center on Juvenile and Criminal Justice. We want to comment on the California State Auditor's scathing report on the deaths in San Diego County jails. We are moving backwards. The yearly deaths in county jails across the state increased from 130 in 2006 to 156 in 2020. The Bscc must improve the statewide standards to ensure the health and safety of people under their care. From 2006 through 2020, 185 people died in San Diego jails, one of the highest totals among counties in the state. The auditor's review found that the Sheriff's Department failed to perform safety checks to ensure the well-being of people under their responsibility. For example, video recordings showed that staff spent no more than 1 second glancing into people's cells, sometimes without breaking stride. When staff eventually did their job, they found that the people under their care had been dead for several hours. We didn't know a jail sentence was a death sentence. One individual urgently requested mental health services after entering the jail. However, the nurse determined they didn't qualify for immediate help. 2 days later, the individual committed suicide, only 4 days after entering the jail. We need to do better. We must do better. The Bscc establishes the minimum standards that local facilities follow. This responsibility must not be taken lightly. Every local jail system throughout the state uses these standards to create policies around safety and care. We urge the Bscc to amend its adult 15 and 24 regulations to 1, ensure county sheriff departments have mental health professionals perform evaluations at intake, and 2, have staff fulfill safety checks that are sufficiently detailed, not merely less than 1 second. The auditor's findings reflect broader trends in California's jails. The Bscc must take a leadership role to protect all Californians. Thank you.
Thank you.
No further comments at this time, Madam Chair.
Thank you, Adam. Any comments, closing comments, anything from board members? Seeing none, I just want to extend my appreciation for all the work we did today. It was a long meeting. We didn't get any breaks, and there was a number of important dynamic issues that we had to make big decisions on. I appreciate everybody's hard work, and thank you. And we'll see you at the meeting on April 7th. In the meantime, if you have questions, comments, anything, please feel free to call me or Katie, and we will help you out.
Thank you, Madam Chair. I want to ask Erin McGuire to speak to a technological logistical consideration we have in mind for our next meeting, which is in April, and the ability to conduct the meetings as we have been doing in this virtual format. Erin?
Yeah, we should probably just mention, so we've been operating under the governor's executive order, which has allowed for the telework and Zoom meetings to happen. There was some legislation at the end of this last legislative session, which allowed county boards to continue to do Brown Act via Zoom for another couple years, but that authority expired for state boards at the end of January. It was extended again by executive order till March 31st. And another bill has been introduced in the legislature addressing this topic as well, but we don't know right now what the status will be in terms of whether we'll be able to conduct this meeting fully by Zoom or if we will have to be meeting in person in April. So we just want to make sure that you're aware and flexible. We could have the opportunity to use the old teleconference authority under Bagley King, which has some logistical problems, which is that's the A person can appear if they're at a public location and their public address is posted. For people who are working from home, that might not be ideal. And then again, maybe the governor will extend the authority anyway at some point in March. We just don't know at this time.
So maybe we'll see in person, maybe we won't. Clear as mud, Aaron, like many.
And to quote Allison Ganter, stay tuned.
Stay tuned.
Yeah. Okay. All right. Thank you all.
Thank you, Madam Chair.
All right.
Thank you.